Yes, you heard it right. You heard it right. Ingestible sensors can transmit data from inside of the body to create insights. I must give you an example. I was in Dubai in Arab Health in the month of February, and I specifically came across a product called Pill Cam by Medtronics. The patients swallow a capsule which has got a tiny camera. It captures thousands of images as it travels through the GI system. It is used for colorectal cancer as well as unexpected intestinal bleeding. It is completely transforming how traditional endoscopy is looked at. We are very proud to organize smart medicine brainstorming on smart medicine Indian initiatives, which is organized by YKG Academy under the aegis of VaidyaRx. We have collaborated with National Academy of Medical Sciences, which is under Ministry of Health and Family Welfare. As mentioned earlier, we have knowledge partners from AIIMS Jammu, IIT Delhi, Jamia Hamdard, Mazumdar Shaw Medical Foundation, SVS Medical College and Hospital, and ZOHO Corporation. We are very keen. Can you move on the next slide? So as this we it took us a lot of effort to bring some eclectic speakers, experts, international experts, so that all the audience, all the people in the audience can take advantage of it, learn what is going on, and how we are courageously in a bold where we are widening the horizon in healthcare. But nothing can is possible without a great team. So it's my duty and an honor to facilitate my team, Nizam, Rohini, Sanjana, Akshat, and Bikram. I think most of them you must be interacting with this during this organization. They have their hard work and commitment is commendable, and it's an absolute pleasure to have them as a team. Next one. I will quickly talk about the agenda. Next 2.5 hours will be extremely exciting with panel discussions, two panel discussions, trigger talks, question and answers, and we have speakers from esteemed organizations like AIIMS, IIT, NAMS, PGI, and even pharmaceutical industry. So I would like to now invite Varun. Next slide. Varun has 15 plus year experience in pharma. He's currently director at Novartis in the headquarters in Basel, Switzerland. Has worked in areas which includes immunology, opto, and neurosciences, and has been champion in market access, drug development, and many other areas. Just to add, before I end, and I hand it over to Varun, during this entire session, we will be discussing about not just smart pills, wearables, but also about prescription analytics, use of AI in drug development, use of AI and new tools, smart tools in clinical trials, genomics, diagnostics, and smart inventory management. It is absolutely mind-boggling that we have got phenomenal topics, and I'm sure everyone would be excited to hear us out. And without further ado, I will allow Varun to take over from here. Thank you so much.
Thank you, Tarun. I hope you all can hear me well. So it's again a pleasure to be amongst all of you and to learn on something as exciting as AI and real world evidence. So before we get into the action, just a thought on why we are doing this and what is this webinar part of. So some of you are probably joining us for a second or third time, but for those who are new, just to recap, what is the YKG Academy aim for and what is the plan? So YKG Academy is essentially an academy, a platform to help you bridge the learning that you have currently as part of your academic curriculum to the industry expectations, to the expectations in the outside world, so that you, as aspiring pharma students or aspiring graduates have good knowledge on what's happening in the industry, in the external healthcare environment, and you are updated with the contemporary issues. So, our mission is very simple to upskill you so that you become relevant to the industry that you will likely join in coming years. Our aim is to also prepare you, so not just for the topics, but also we plan to do some mock interviews so that you are technically strong and communication wise also efficient. And then through this platform, that happens naturally is you will meet a lot of people from different domains, as Tarun highlighted. So use this opportunity to ask questions, connect offline through LinkedIn, and we will have multiple face-to-face events also to bring you in. So in a nutshell, our and this is what we have been doing, and this is an endeavor. And why do we do this? Importantly, is to all of us have had enough experience collectively, and it is only then our duty to give back. And more importantly, I believe that the talent that we have in India is extremely exceptional, and it can only become better to then not only lead in India but also multinational and globally. So this is summary of the events. I will not go through the details, but you see the diversity of topics that we have been covering in the last quarter, and then there are more events to follow, which I think is in the next slide. Yeah, if you can move on. Okay. So we will also share with you towards the end. We have some sessions planned already. We would like to take your feedback, and we'll also then plan the sessions forward with your feedback. With that, I hand it over to Professor Gupta to open us up on this session. Please keep your questions, pens, and paper ready for an exciting session to begin. Over to you.
Thank you. Thank you very much, Varun. And I welcome the more than 200 smart delegates or people who are attending this. I would say, I don't know whether these 200 who have already joined are smart or those who have registered but not joined, they are smart. Because many people have joined, are joining because of the certificate. I think they are less smart than those who have joined because they are getting smart knowledge. As Varun said, that me and Mr. A.K. Pradhan, former Joint Drug Controller Delhi, we started of India, we started this academy to give knowledge, skill, critical thinking ability to our postgraduates in pharmacy, in medical, and also the young professionals in the field of pharmaceutical sciences. What we are planning to do is take all those subjects which are not so commonly taught formally in the education system, but are so critical when you go into the job or when you come into the professional skill. And that's why what Varun mentioned, that we did a couple of virtual and online and face-to-face workshops on these issues, including how to face interviews for clinical trial related jobs recently. The topic which we have selected is smart medicine. You will remember there was, and also I must thank National Academy of Medical Sciences for collaboration on this very important topic. And I will tell you one thing, that National Academy of Medical Sciences has also started a course on artificial intelligence in health, which is open for registration, and that is an online course for 3 months. And that is aligning with what we are doing in collaboration with them. Also, smart medicine has been recognized as a thrust area by WHO and IUFAR, and May is the month where the smart medicine is being celebrated as the Innovation Day for Artificial Intelligence and Machine Learning. And that's why this is such a contemporary topic, that if you are not aware of artificial intelligence and machine learning use, in the entire medical sciences, you will be considered as outdated. So my thanks to Dr. Umesh Kapil, the Secretary of National Academy of Medical Sciences, and of course Dr. Bera, who will be giving inaugural address in this. We also have with us Dr. Shakti Gupta, Professor Shakti Gupta, who is a Director of All India Institute of Medical Sciences, Jammu, and also the Vice Chancellor, uh, Dr. Afsar Alam Sahab, who is the Vice Chancellor of Hamdard University, a world-renowned computer specialist, particularly in health sciences, also into this area. What is smart medicine is primarily the involvement or application of artificial intelligence, machine learning, and digital platform in different aspects of health sciences. Just to give you a few examples here, it can start with the simplest thing is in the prescription analytics. You digitalize prescription, you analyze prescription, and then that's what VaidyaRx is doing in couple of institution, SVS Medical College, in AIIMS Jammu, in AIIMS Rishikesh, and in SRM Chennai, and couple of other places. And Niti Aayog is also interested in that. Once you digitalize this, you can get every information, the patient prescription behavior, prevent adherence, increase adherence, reduce the medication error, and have a data analytics for predicting the possible uh, purchase and inventory control, and so on and so forth. All India Institute of Medical Sciences has done at Jammu has done couple of innovations, and Dr. Shakti will give on that, starting from innovation, digital innovation for patient help in localizing the area to pharmacogenomics, patient that is also one of the important thing. Patient in pharmacology, if you just see, starting from, as Tarun mentioned, smart pills, जो क्लिनिकल ट्रायल में काम कर रहे हैं, अगर हमको प्रॉब्लम होती थी कि हमने एक पिल खाया और उसने निकला कि नहीं निकला, whether solid or not solid, now you can see that it goes where it goes into stomach, it goes into rectum, and it is so you have the kinetics of the pill because of the sensor application into that. We thought that why not we leverage the Indian startups. Now there are more than 600 startups working on medical smart things. They are developing smart wearables. IIT and AIIMS, IIT Madras, and are developing all wearables which can predict because of your heart rate variable, because of EEG and SpO2 values and all those derivatives. It can predict several health parameters. The quality of life prediction can be done through the smart assessment of the information in patient like chronic diseases, in patient of cancer, in patient of diabetes. In cancer, this is very particularly important where you see the pharmacogenomics based application. And now, incidentally, Dr. Kamla, she would have given the idea, and I can talk on the pharmacotherapy through the immune enhancing mechanism or even gene therapy, which is now again in smart therapy. The nanotherapy, theranostic, is one important area where the smartness because of the rays and the enzymes or the therapeutic agent will go at the site where the action is required, sparing the health of sparing the normal cells. That is again is a very important thing. And and biosensors. This is Hamdard University is developing biosensors. IIT are developing biosensors, and these biosensors, just biosensors from the nose of your and from the different sensing mechanism, it can detect the disease, it can detect the prognosis. The blockchain technology, which Dr. Mr. Pradhan will talk on, is now smartest mechanism by which the the drugs which are spurious or substandard or maybe misbranded can be prevented. The and you see that telemedicine is one of the most critical thing where you can reach from a tertiary care hospital to the remotest possible place. And that is why we considered that there is a need for very important synergy between technology, particularly AI, ML specialists, computer specialists. And I am grateful to Dr. Afshar Alam, sir, who has joined here. And there is a fundamental shift, and there is a technology revolution. And that's why we thought that this is smart medicine at least should sensitize those postgraduate, can take some area to work upon, get sensitized, so that when you go at a job front, when you go appear in an interview, when you look for some topic for your thesis, you can do some meaningful, purposeful research. So thank you very much all. And can I know whether Dr. Behra has joined, because he was busy somewhere. So Dr. Behra will
Yes,
be
yes,
joining.
yes, yes, sir.
Oh,
I am
Dr. Behra
there.
has joined. So Dr.
Yes.
Behra has joined, and I must mention that Dr. Behra is president of National Academy of Medical Sciences, who has initiated this AI, um, the program, which is aligning with ours, and he has a very great motivator, world known expert in tuberculosis. So I would request uh, Dr. Behra to give the inaugural address. Dr. Behra,
Yes,
please.
yes. Thank you very much, sir. And a very good afternoon to all of you. And my greetings from the National Academy of Medical Sciences. Ladies and gentlemen, I congratulate the YKG Academy for its collaboration with NAMS in organizing this brainstorming on smart medicine. I am also happy to note that the knowledge partners are the AIIMS Jammu, IIT Delhi, Jamia Hamdard, then the Mazumdar Shaw Medical Foundation, and others. I am also happy to note that more than 1,200 people from nearly 200 academic institutions across the country are attending the brainstorming on this contemporary topic. As per our Prime Minister's vision of Digital India, smart medicine is poised to play a pivotal role in the transformation of healthcare across the country. In an era where technology permeates every facet of our lives, the field of healthcare is undergoing a significant transformation. The advent of smart medicine, a term that encapsulates the use of advanced technologies like artificial intelligence, the Internet of Things, the big data, and robotics in healthcare, is revolutionizing how we approach medical treatment and patient care. The genesis of smart medicine can be traced back to the early days of digital health records. However, it is the recent advancement in AI and machine learning that have catapulted this concept into the limelight. From algorithms that can predict patients' risks to apps that monitor chronic conditions, smart medicine is making healthcare more proactive rather than reactive. Presently, smart medicine manifests in various forms. I think some of them are already being told to you by my previous speakers. Say, for example, telehealth and remote monitoring, wearables, devices, and mobile health apps enable continuous monitoring of patients, especially those with chronic conditions, reducing the need for frequent hospital visits. Then personalized medicine, that is leveraging genetic information which Professor Gupta just hinted, Then the smart medicine allows for treatment tailored to individual patients, enhancing the effectiveness of therapies. Actually, just now in my clinic, I'm just sitting with the report of a lung cancer patient. Actually, I am interested in the field of lung cancer and practicing for the last since 1980s. At that time, we had got hardly anything. Now you see, I get the genetic information, the what we do, the genetic testing. So now in front of me is a patient of adenocarcinoma, and she is the EGFR, a positive. That means the patient of adenocarcinoma, I'll just give her, the oral tablet, and she will take it, as long as it is possible, and she will have a very, very long life. Let me tell you, almost there are patients who are surviving for now 10 years, 12 years, 15 years, which was a dream which was never heard of in lung cancer. So this is what is the usefulness of genetics, and then the information about genetics. Then predictive analytics, like using big data, healthcare providers can predict outbreaks, patient admissions, and other important trends, leading to better resource allocation. Robotic surgery, which is an again exciting thing in the field of medicine, with enhanced precision and control, robotic systems are transforming surgical procedures, minimizing risks, and improving the recovery times. Then the transformation in healthcare driven by smart medicine has led to more patient-centric services. AI and machine learning have enabled more accurate diagnostics and treatment plans. Moreover, blockchain technology, which I think again Professor Gupta told, and we are going to hear more detail from Dr. Pradhan. It is ensuring secure and transparent medical data management. Patients now are more knowledgeable and have more control over their health with access to real-time data and virtual consultations. For healthcare providers, these technologies means more accurate diagnosis, efficient treatment plans, and better patient outcomes. The data-driven approach enhances the diagnosis, treatment, and continuous patient monitoring while shifting the focus from reactive interventions to predictive and preventive care. This not only improves drug adherence but also personalized treatment regimens and optimize the therapeutic outcomes. By enabling real-time tracking of medication intake and providing clinicians and patients with actionable insights to reduce healthcare costs and support the evolution towards patient-centric precision healthcare. Several healthcare professionals in institutions of national importance like AIIMS New Delhi, PGI Chandigarh, JIPMER Pondicherry, NIMHANS, CMC Vellore, and several medical institutions are jointly working with the technology and engineers in several IITs and the pharmaceutical and device industries. Then some of the key areas of smart medicine are, as again has been told, like smart pills, which are embedded with the sensors, can track data related to adherence to prescribed regimen and also for diagnostic purposes. Then smart pill boxes, bottle caps, mobile application-based patient alerts to take their medication on time, helping in increasing adherence to treatment plans, improving compliance, and better therapeutic outcome. AI and data-driven personalized dosing schedules, prediction of adverse drug reactions in cancer and many other chronic disease patients. That is what is the personalized dosing schedule. And personalized treatment can be achieved by tailoring the treatment based on genome sequencing. Just now I gave you one example, and biomarkers data which ensures higher efficacy and lesser side effects. Say, for example, for cancer patients or genetic disorders. Increasing number of institutions have started the facility of whole genome sequencing and particularly using the results in the treatment of cancer and some neurological disorders. I understand that VaidyaRx, a digital prescription analytics that organization is successfully contributing to the digitalization of prescription, which is useful in real-time insights into prescribing patterns and medication trends. It can help in antibiotic stewardship and enhance adherence and compliance. Wearables like smartwatches and fitness trackers use motion and biometric sensors to monitor parameters such as heart rates, blood pressure, the oxygen saturation, sleep, temperature, and activity levels, supporting daily health management. These are the wearables. Then the telemedicine and AIM Health apps are enhancing the healthcare accessibility, especially in rural India, by enabling timely consultation and reducing out-of-pocket expenses. I'll just give you an example. Tuberculosis is my area of interest. The how smart medicine is helping in tuberculosis. Rather, actually, you see, the smart medicine significantly strengthens the tuberculosis management by enhancing the detection, treatment adherence, monitoring, and personalized care, especially in high burden countries like ours. Digital tools such as AI assisted AI-assisted diagnostics, say for example QXR or the chest X-ray, digital molecular platforms like GeneXpert and predictive analytics, they enable early and accurate diagnosis while forecasting treatment outcomes. Personalized precision medicine integrates multi-domain data for tailored dosing and care strategies. Digital adherence technologies like 99 dots is a very good example how our the NTP or the National TB Elimination Program of India is practically monitoring the adherence issues in patients, replacing the earlier the by the manual or the personalized ways. This is along with the AIM Health apps and smart pillboxes, they improve the medication and adherence. Systems like Nikhya, all of you must have heard the Nikhya portal that enables the real-time case tracking, while community-focused apps like TB Arogya Sathi, they enhance the awareness and engagement. Overall, smart medicine empowers data-driven decision-making and targeted interventions, accelerating progress towards TB elimination. However, ladies and gentlemen, I must tell you the some of the challenges and concerns. Despite its benefits, smart medicine faces several challenges. Data security and privacy, as healthcare data becomes increasingly digitalized, one must be very careful to ensure its security and confidentiality, which is very paramount. The second issue is the ethical concerns. The reliance on AI and algorithms raises ethical questions, particularly around bias and decision making in patient care. Accessibility and equity. There is a risk that smart medicine could widen the health disparity gap as not all patients have access to the latest technologies. Then the regulatory guidelines and compliances to address these challenges, the stringent regulatory guidelines and compliance standards are necessary. This includes adhering to laws like HIPAA in the US for data protection, then the GDPR in Europe and other local regulations. Continuous oversight and updating these regulations are critical in keeping pace with the rapid advancements in technology. Then what is there to look ahead? The future of smart medicine is one of immense potential and exciting possibilities. As we move forward, we can expect even more personalized treatments, advanced diagnostics, the tools for that, and innovative solutions to complex health problems. Advancements in genomics and biotechnology might lead to more precise and individualized treatment strategies. Additionally, augmented reality, that is AR, and virtual reality, that is VR, they are expected to play significant roles in medical training and patient education. Smart medicine represents a paradigm shift in healthcare, offering unprecedented opportunities for improving patient care and health outcomes. However, balancing technological advancement with ethical, legal, and social consideration will be key to fully realizing the benefits of smart medicine. As this field continues to evolve, it will undoubtedly play a crucial role in shaping the future of healthcare. In nutshell, I can say that smart medicine is going to play important role in the future of personalized healthcare. Thus, the integration of machine learning based artificial intelligence in healthcare is transforming and will transform the way medical professionals diagnose, treat, and manage patients. However, there is a challenge here. Many clinicians, biomedical researchers, policymakers for healthcare delivery, and health administration and paramedical staff lack the necessary skills and understanding to effectively leverage these technologies and take these advantages. Thus, there is a need for a running orientation and advanced courses on applications of AI in healthcare for medical professionals and others I have just named. The orientation courses should be designed to bridge this gap by equipping clinical and paraclinical biomedical professionals with the knowledge and the tools to understand, evaluate, and apply AI in clinical settings, ultimately enhancing patient care and operational efficiency. Advanced courses need to be planned to professionals who have taken orientation courses to deepen their knowledge by going over discipline specific applications in more depth. We should develop orientation courses which are to be designed with the objective of providing a fundamental or the foundational understanding of AI and its relevance to healthcare, then familiarizing participants with the applications of AI tools and technologies in clinical practice and fostering awareness of ethical and governance issues related to AI and medicine. Advanced courses would be designed to go into the discipline-specific applications. I am sure the participants here will be provided with the different initiatives in smart medicine and their benefits in the healthcare system in India. You see, as you know, the National Academy is the highest academic body in the field of medical sciences. We provide various, the scopes and facilitate the medical and the medical professionals in the country. I am not going to detail them, and we have got something to offer for everybody in the field of medicine. As Professor Gupta has already told, NAMS is taking a leading role in spreading AI literacy among medical and paramedical personnel in the form of online certificate orientation courses on AI in health for postgraduate medical students, faculty, and medical professionals in collaboration with Triple IIT Hyderabad. One batch of 140 participants have completed the course, and the second batch is going to start from 15th of June in the next month. We'll start more new initiatives to include more institutions and medical colleges in the country and becoming part of the India AI mission. This particular brainstorming session on smart medicine is one such collaboration with the YKG Academy, and we will continue to support and partner in future also. Ladies and gentlemen, I will again invite you to become a part of the NAMS in other areas also. Thank you very much, and I wish you all the very best. Jai Hind.
Thank you very much, sir, for your wonderful address and inviting all the delegates and scientists and medical professionals to become member of National Academy of Medical Sciences, which is now become a very vibrant organization under leadership of Dr. Bera and Dr. Kapil, who is the secretary. And now I request very respected computer specialist and vice chancellor of Jamia Hamdard, Professor Afsar Alam Saab, and he was to go for a meeting, and I am really thankful to him, Professor Afsar Alam Saab, that in spite of your such a hectic schedule, you are here. And Professor Afsar Alam is recipient of several awards and member of all committees you can name, and he is one of the visionary in giving a new direction to Jamia Hamdard, which is an A++ university for last several years, and his leadership is par excellence. So over to Professor Afsar Alam Saab.
Thank you, sir. A warm good afternoon to all of you present here. I am very happy and delighted to know that YKG Academy for Contemporary Issues in Health and Pharmaceutical Sciences under the aegis of VaidyaRx Pvt Ltd, in collaboration with the National Academy for Medical Science, Delhi, has organized this brainstorming session today. Professor Y.K. Gupta, sir, the President of AIIMS Delhi, Jammu and founder of YKG Academy. Professor Shakti Gupta, the Executive Director and CEO of AIIMS Jammu. Professor Digambar Behra Saab, the President of National Academy of Medical Science, Ministry of Health and Family Welfare, Government of India, and all the participants. The smart today I'll discuss about the smart medicine, what the India initiatives are there. Since I have a very urgent meeting, so I'll take not too much time, but I'll just highlight a few issues related to smart medicine. The Smart Medicine India initiative represents a paradigm shift in a healthcare delivery, leveraging cutting edge technology to create an integrated, accessible, and efficient healthcare ecosystem. This ambitious program aimed to bridge the healthcare divide between urban and rural areas while establishing India as a global leader in a digital health innovation. The initiative focused on democratization of healthcare access through a telemedicine platform, electronic health record, AI-driven diagnostic, and IoT-enabled medical devices. It seeks to reduce the healthcare cost, improve treatment outcomes, and enhance the patient experience across all the socio-economic segments. The target groups we have to connecting 150 lakhs plus health wellness center digitally, establishing comprehensive electronic health record for citizens, implementing AI powered diagnostic tools in tier 2 and tier 3 cities, creating interpretable health data system across the state. So the backbone include the robust broadband connectivity, cloud computing platform, secure data storage system. The National Digital Health Mission provides the fundamental architecture with the unique health IDs for every citizen, standardized health data format, and secure the information exchange platform. The We have to integrate the AI and machine learning integration, as Professor Behra has already mentioned and detail he has given the features. The advanced algorithm assist in early disease detection, the drug delivery, treatment personalization, and epidemic prediction. The machine learning model analyze the medical imaging, predict patient outcome, and optimize the resource allocation in hospitals. Comprehensive teleconsultation platforms connect patient with a specialist regardless of geographical barriers. Remote monitoring device track the vital signs, medication, endurance, and chronic disease management from the patient home. The initiative follow a systematic implementation across a different healthcare level from primary healthcare centers to tertiary healthcare hospitals. The pilot program in select state demonstrated the proof of a concept before the nationwide scaling. The most important thing, as Professor Behra mentioned about the ethical issue and legal issue, but the capacity building enhancement is very important. The extensive training program for healthcare workers, administrators, and the technical staff ensure the smooth adoption. The digital literacy champions educate the patient using smart health technology effectively. And we have to also go for the partnership between the public private partnership, the collaboration with the technology companies, pharmaceutical firms, and healthcare provider accelerate the innovation and ensure the sustainable funding models. The comprehensive digital patient record accessible across the healthcare facility, the enable continuity of care, reduce medical errors, and support the evidence-based treatment decisions. The Internet of Things integrated create the intelligent hospital environment with the automated patient monitoring and inventory management and energy optimization systems. Genome integrations and personalized treatment protocol based on individual genetic profile, the lifestyle factors and environmental conditions. The preventive healthcare is also the wearable device and mobile application promote the health awareness, track fitness metrics, and provide the personalized wellness recommendations. The benefit of these implementation, the rural population gain access to a specialist consultation with the advanced diagnostic service previously available only in the metropolitan areas. They reduce the travel cost and time for patient and families. The digital platform reduce the administrative overheads, eliminate the redundant tests, and optimize the resource utilization. The preventive care focus the reduce long-term treatment cost. And definitely, Professor Behra has already mentioned about the quality improvement, the standardized protocols, decision support system, continuous monitoring, enhancement, treatment quality, and patient safety. So these are the area where the smart medicine is there. So next time, Professor Gupta, I will attend full program because I'm just outside the ministry. So thank you again for inviting me. Thank you very much.
Thank you very much, sir. I think you're, in spite of your such a busy schedule, you could spare a few moments for us and for addressing these young. I understand that the young people who are attending this and giving them that what is the importance of smart medicine right in the tertiary care hospital to uh, poorest of poor and remotest part of the country in reaching their healthcare delivery system. And that is why our young generation must get ready for working on this. So thank you very much, sir. And for all the audience, we are organizing a full 2-day workshop and conference in AIIMS Jammu in the month of September. We will be informing you soon. So thank you very much, sir, for your address. Now, I would like to introduce to you Professor Shakti Kumar Gupta, who is Executive Director and CEO of All India Institute of Medical Sciences, Jammu. He is an icon. He is the person who is the most knowledgeable, most respected, most innovative oriented hospital administrator. And he has transformed All India Institute of Medical Sciences, Jammu. Not transform, he made it. And it is worth seeing going there, and that's why we are planning to have a full face-to-face workshop there in support of National Academy of Medical Sciences and quite many others. So, Dr. Shakti Gupta, over to you, sir.
Thank you so much, sir. Thank you so much. Good afternoon, esteemed dignitaries, participants, and dear friends. So actually, I want to share actually what initiative we have taken in AIIMS Jammu. and especially in the area of smart solutions. So can you have a presentation? प्रेजेंटेशन मिलेगा नहीं, ये साइड में आ रहा है, इसके भी आ रहा है. Oh, yes. So, are you able to hear me? Hello.
Yes, yes, very well.
Sir, extend greetings from AIIMS Jammu. Yeah. So
we can
sir,
see the slides and we can hear you very clearly.
Right, sir. Actually, so I want to share the vision of the Honorable Prime Minister of India, Shri Narendra Modi ji. What he has said, that AIIMS like institutions, they aim to address regional healthcare imbalances, encourage evidence-based research, and elevate medical education standards in our country. So, as everybody is aware that this is a trinity of mission of all the AIIMS in the country. On the top is the education, followed by research, then the patient care. So, our vision in AIIMS Jammu is a global village for healthcare. What I want to say is that AIIMS Jammu envisions a global village of patient-centric care, blending technology, skilled manpower, affordability, and Indian values to deliver world-class accessible healthcare for every citizen. So we have certain unique initiatives in AIIMS Jammu. The first is that we believe the patient is first for us. If I am there, if building is there, if hospital is there, it is all because of the patient. And we must respect and treat the patient with dignity. Every patient's comfort is our priority, and AIIMS Jammu is dedicated to delivering compassionate, patient-centered care. So, sir, actually, I hope you are aware that recently our Lieutenant Governor of Jammu and Kashmir, he visited, and he has declared AIIMS Jammu as a pain-free AIIMS. What I want to convey is that when a patient comes, and pain is there, that should be the outside AIIMS Jammu. When he enters the hospital, he should not feel pain in the hospital. So AIIMS Jammu leads the way as the region's first pain-free hospital, ensuring healing without suffering. So then actually, sir, we have started a 24/7 diagnostic laboratory dedicated for the emergency, then inpatient also, and in addition to OPD services also. But this 24/7 diagnostic laboratory with components from Department of Pathology, Biochemistry, and Microbiology, they provide 24/7 diagnostic services. But these are in addition to the comprehensive lab facilities of pathology, biochemistry, and microbiology, which have been established in the academic block. Now we have most modern radio imaging services. Then actually we started our OPD on 1st of August 2024. We are, sir, actually, we are taking baby steps, and AIIMS Jammu is only 9 months old. So services available are in 32 departments, out of that 20 super specialty departments and 12 super specialty departments. We have also actually started the inpatient and emergency services at AIIMS Jammu. And you can see that the number of patients which are being treated in inpatient as well as in trauma and emergency. On an average, we are getting about 50 to 60 trauma and emergency patients in our emergency daily. Then, sir, we have already started actually skeletal 12-bedded emergency ICU services, which is dedicated only for the emergency services. And we have treated about 700 patients in last 9 months. But in addition to that, there is a provision of 193 ICU beds in AIIMS Jammu when it will be fully functional. That is so 750 beds. As on today, we have actually put about 400 beds. Then we have also started actually OT services from 17th of September 2024, which are most modern. We have got about 20 operation theaters. And out of 20 operation theaters, we have started 7 operation theaters as on today. And these are our most modern modular operation theaters, which are almost ready. Now we want to extend this services to other OTs also. Next. Then actually, sir, we have also started dialysis services at AIIMS Jammu. Next. Then, sir, actually, I'm happy to share that yesterday we started a trial run for the blood transfusion services. AIIMS Jammu received license for the collection and processing of whole human blood and its components along with the apheresis on 13th of May, this month only. And AIIMS Jammu, I can say with proud that AIIMS Jammu is going to be the first AIIMS to have the following equipment. NAT testing facility will be there. Chemoluminescence-based viral marker screening facilities, fully automated hematology analyzer, blood component irradiator, and 3 apheresis equipment besides others. Next. Then actually, as you know that AIIMS Jammu has already established a first poison information and management center in the Union Territory, which is a specialized unit with evidence-based software, specialist doctors, and dedicated team. Next. Then we have also started a very unique support services for the patients. Like we have introduced a concept of patient care managers, patient care coordinators, and patient assistance services, which take care of the patients. Then in addition to that, we have started the shuttle services with electric vehicles, which are about 16 in number, and we call it a Parikrama Seva. Then in addition to that, we have a 216-bedded night shelter, which is ready for the attendants. Besides, we take care about the requirements of the staff, patients, and those of visitors. We have a Kendra Bhandar, Jan Aushadhi, Amrit Pharmacy, and banking facilities also. Then actually, sir, when we talk about the patient-centric infrastructure, we have already night shelter for attendants, which can accommodate about 216 patient attendants. Beside that, we are providing a clean, accessible green campus, which is a barrier-free movement for differently abled, eco-sustainability through solar, rainwater harvesting, and green zones. Then, directly, we are also started the community outreach and preventive care services. We have telemedicine by Sanjeevani, mobile screening camps, and health education campaigns also. Now, when we talk about the smart medicine, so I want to share what initiatives we have taken at AIIMS Jammu. Sir, the most important is the digitalization of prescriptions and analysis for rational therapeutics, thereby reducing medication errors and antibiotic surveillance and steward at AIIMS Vijaypur Jammu. The objective of this project is to integrate hospital management information system data with the digital platform for prescription audit, then analyze this medicine used to identify if there is any error and drug interactions, then monitor antibiotic use across the disciplines and align with the antibiogram, provide feedback to clinicians for rational therapeutics and better outcomes, and also to perform pharmacoeconomic analysis, assess the NLEM versus non-national list of essential medicines usage for policy point of view. Next. Now we are very advanced in digitalization of AIIMS Jammu. So we have already introduced a seamless integration of healthcare ecosystem with the digital health ecosystem in place, which is outcome-based and real-time analytics and open in this interaction. And in addition to that, actually, we want that our patients should be empowered, actually. And then, sir, when we talk about the digitalization of AIIMS Jammu, these are the modules which have already been implemented, and these are the other modules which are in the implementation phase. And I can say with confidence, by October, our AIIMS Jammu will be total digital, and it will be a paperless hospital. Then, sir, actually, these are the steps toward digitalization of AIIMS Jammu. which is a app-based appointment system. AIIMS Jammu Swasth app available on Google Mac, Play Store and iOS. Patient can book, reschedule appointment through AIIMS Jammu app. Patient and doctors can check for OPD, lab services and their tariffs. Next. Then actually, sir, we have a very unique system which has been introduced. That is an indoor navigation system, which actually guides the patients. Actually, what this indoor navigation system is there. So this is actually basically for the guidance of the patients. This indoor navigation is a seamless, providing seamless care, ensuring no patient is left alone at AIIMS Jammu, providing guidance at every step. No, this is a real-time location tracking on user-friendly maps, ensuring patients reach their appointments without getting lost. It provides voice-guided navigation for visually impaired individuals and calculates the most efficient routes, considering the stairs and elevators to aid the patients with mobility limitations. Now, this is the most modern system, which also gives detailed direction to the departments, wards and facilities, reducing the need to ask patient for help and displays information about nearby amenities. So this actually services which has already ready. Now we have invited our Honorable Health Minister to inaugurate these facilities. Now another important is that it functions like a GPS for indoor environment. Then it provides precise location tracking and real-time navigation assistance throughout the hospital. Next. No, sir, this is a system. AIIMS Jammu is the, I can say AIIMS Jammu is the only AIIMS in the country which has developed a patient referral system. So those patients who are walking patients, they go to the AIIMS block and then actually they are treated and disposed from there. And then 20% of this, 80% are disposed from there. And 20% of patients who require some cross consultation, they are sent to the main OPD. Then the treatment and disposal is being taken care. Now, then other patient with the app-based appointment. So it is very easy. They can take the appointment from home, book the appointment, then reach the main OPD, and then actually the treatment and the disposal is being done actually. So I can also, sir, feel proud of talking about the digital library which has been established in AIIMS Jammu, and it is a functional. So these are the few glimpses of the library. I am very proud that we have introduced a children corner in the library itself. Whenever actually any faculty or staff, they go to the hospital to utilize this library facilities, and we are encouraging they should bring their children 3 years and above and develop them the habit of utilizing the library services actually. So these are a glimpse of this is a new arrival section. Then actually we have got actually next, and this is a discussion rooms which are shown pro discussion for the researchers. Then actually we have got reading areas. Then these are the library resources which has been already provided in AIIMS Jammu. And we provide a smart card along with the password to the faculty, to the students. They can use these library resources sitting even at home. And we are also proud to share that AIIMS Jammu collaborated with Ortho Clinical Diagnostics to enhance laboratory automation with cutting-edge waterless technology. It is a totally robotic lab which is going to be commissioned in another 2 weeks' time. And we can actually process about 1,000 tests at a time, and the turnover time will be about 1 hour or so. And then actually we have also established Center for Advanced Genomics and Precision Medicine, and thereby bringing cutting-edge next-generation sequencing technology. So I'm happy to share that we have started getting the sample from AIIMS Delhi, from Coimbatore, from Calicut, and from Manipal Hospital. It will function not as a referral center in the northern India, but in the country. And I am also expecting that we will get patients from the neighboring countries also, that samples. It will transform the fields of pathology, oncology, gynecology, and transfusion medicine. Then, sir, actually, the Center for Advanced Genomics and Precision Medicine was inaugurated on 2nd of February by Honorable Dr. Jitendra Singh. He came but he was not able to come. But you can see you all were there actually when this center was inaugurated actually. Then actually, this is a inauguration of OT complex. Honorable Lieutenant Governor Shri Manoj Sinha inaugurated OT complex. At present, we have commissioned about 8 advanced OTs, but in 2 to 3 months' time, we'll be commissioning all the 20 operation theaters. Next. Then we have also introduced, started the oncology services at AIIMS Jammu. Honorable Lieutenant Governor Shri Manoj Sinha inaugurated state-of-the-art radiotherapy and oncology department on 31st of January. Then actually, we are very proud that the Honorable Governor has released pain policy at AIIMS Jammu. Then, sir, these are some glimpses what we have introduced. AIIMS Jammu launches state-of-the-art endoscopic procedure unit. Then actually, sir, it has also started fundus fluorescence angiography services. Then it has also achieved historic first surgery which was dedicated, and its success was dedicated. And a heartfelt tribute was given to the Honorable Prime Minister on his birthday. Then actually, sir, AIIMS Jammu also expands Horizons pediatric surgery now available for infants and children. Then a new dawn for hope for the people of J&K in comprehensive cancer care has been started over here. Then AIIMS Jammu expands surgical services with successful thyroid tumor surgery, which was a milestone in specialized surgical services at AIIMS Jammu. Then AIIMS Jammu also debuts oral and maxillofacial surgeries, which is poised to transform the face with the temporomandibular joint and corrective jaw procedures. This was a very successful surgery, and our dermatology is not lacking behind. They are actually they are leading the way forward in diagnostic and procedural dermatology. Then actually, sir, AIIMS Jammu also performs first image-guided non-vascular intervention has already been started over here. And AIIMS Jammu also conducted first femoral-popliteal bypass surgery, offers a new hope for the PVD patients in the region. And then also successfully commences spine surgery. It and to expand its medical services to the people not only from the J&K but to the Punjab and Himachal also, because we are getting patients not only from Jammu but from Punjab and Himachal and Leh and Ladakh also. Now recently we have got a patient from the Haryana also. So Department of Surgical Gastroenterology AIIMS Jammu successfully performs first palliative esophageal self-expanding metallic stent placement also. Then AIIMS Jammu also achieves milestone which completes 1,000. Now at it has reached about 3,000 ENT endoscopies on OPD basis. AIIMS Jammu has also achieved another milestone with groundbreaking rehabilitation surgery on a young patient. Then actually it has also expands orthopedic services with total knee replacement surgeries. So AIIMS Jammu also initiates laparoscopy surgeries, performs first laparoscopic cholecystectomy recently. Then also, sir, it initiates laparoscopy surgeries, which next. It also said, no, eye department also achieves milestone by initiating vitrectomy surgeries also. Then also, sir, we are sculpturing the perfect jaw line, that is transforming lives through the advanced jaw surgeries at the AIIMS Jammu. So, sir, these are the initiatives we have started. You know, sir, actually, we are taking baby steps, and it is only 9 months old. And for the initiatives, and that was a smart initiative, I think long way we have to go. And I can assure you that we'll try to come to your expectations. Thank you so much, sir.
And thank you very much, Dr. Shakti. And it was really a matter of pride for every citizen in India that we are developing, and we have developed such a innovative, wonderful hospital. And usually हम लोग कहते हैं ना कि जब बच्चा पैदा होता है, उसके बाद बड़ा होता है, उसके बाद में वो स्मार्ट दिखने लगता है, अच्छी टाई सूट वूट पहन के फिर स्मार्ट लगता है. But this is an example where a child is born with super smart technology. Because just 9 months old, All India Institute of Medical Sciences, Jammu, is using all smart technologies be it in the patient management, be it in the operations, be it in the prescriptions, be it in the genomics, and be it in the management of anything. So when you say smart, it is artificial intelligence, machine learning, digitalization in every aspect. And what Dr. Shakti said, that we are trying to make this hospital as a paperless hospital and most efficient hospital, where the turnaround time will be much, much lesser, and the data generation will be used for any productivity. So thank you very much, Dr. Shakti, for your leadership taking this. And that is why we have chosen this a full 2-day workshop or smart medicine at AIIMS Jammu in the month of September, and all those who are interested may please. Thank you very much, Dr. Shakti, for giving this inaugural, wonderful inaugural address. So thank you. Now I would request the panel discussion on the next session, and that will be chaired by Mr. A.K. Pradhan. A.K. Pradhan ji is, and of course, I will not be complete. It will not be complete unless I thank Dr. Umesh Kapil, who is the Secretary, National Academy of Medical Sciences. Because of discussion with him, he suggested that we can perhaps give a platform, and they have assured us the continuous, because the entire nation is looking for such type of sensitization. And therefore, thank you very much, Dr. Kapil, if you are listening. Thank you very much. But of course, we cannot thank you enough on this platform. So now, Dr. A.K. Pradhan, who is the former Joint Drug Controller and also co-founder of this academy, and also Vikas Mehdi is a world-known pharmacologist. He is perhaps the pharmacologist of rare species who is also representing in International Union of Pharmacologists, and he also organized a smart medicine workshop on which I got motivated and then did that. So they will chair it, and over to Mr. Vikas.
Yes, sir. So good afternoon, everyone. Pradhanji, yeah, so I'll just have a brief introduction. And all of us we talked about, we had already listened to all the dignitaries, but I just give you the brief how the new technology actually it is going to help us. So I just wanted to tell you that, we have some success story during this COVID-19 fluida. Okay, we developed this technique for a diagnostic. So if you look at toward precision medicine today, we have already done a lot of work on, collecting the Indian sample to develop, precision medicine toward individualized therapy. So that is why that, correlation with the clinician, with the technology is very important. So I'll not go in, detail, but obviously we understand the cutting edge, monitoring, and that's how we are doing in order to establish the patient safety in the clinical situation or in the hospital in near future. So definitely indigenous technology is always welcome. So with this brief introduction, I request Pradhanji to give a brief remarks. So then you can request Dr. Barun to take the lecture. Over to Pradhanji.
Yeah, thank you. Thank you, Dr. Vikas. I think, we are going to have an excellent panel discussion on these three issues, basically. That AI and real world evidence, how it is used and how it is changing the drug development paradigm, and also the database inventory management and budget planning, and also digital platform from prescription analytics. So without actually waiting further, I think we can start our panel discussion. So I request Barun to give his talk on AI and real world evidence changing the drug development paradigm.
Thank you, Pradhan. So I hope all if you can hear me. So thank you, and
go ahead, please.
Thank you. So we will start the session. I will keep the talk focused on the key points. So I thought I will broadly cover where do we see AI and real world evidence being used in pharmaceutical companies. So I work with Novartis. All what we present will be my own views, nothing confidential from the company. So as we move on to the next slide, in this 7-8 minutes, I wanted to encourage you to think where all AI is currently being used, and also then will encourage you to look at developing and learning AI skills. So next slide, please. So I think you have already got an idea from different speakers, the expanse of AI that we see right now. And if you look at it, it actually starts from drug discovery all the way to trial design to personalized treatments and policy design as well. So what I will do in the next 7-8 minutes is give you some examples of how different companies are using it. These slides will be shared with you later. So I will encourage you then to go and do some AI research on these examples, use whatever AI you use to get more knowledgeable in that. The next one. So when we talk about this topic today, smart medicine, to my mind, it is three things: smart, personalized, and scale. So first we start with smart. So if you look at the examples here, these are some of the big companies from companies like Google that you know, how they are using AI in drug discovery. And it starts before we even get to the clinical trials. So they are now using AI to develop protein structures. If you look at what Alpha model is doing, they also then use those structures to test interaction with RNA, DNA, and other drugs so as to improve the possibility of hitting the target. And companies like GSK, Pfizer, and actually many more then use these structures and run AI models to find the right target and take it to clinical trial. So a lot of improvement happens before we start even the first in human trial, and it's being used in spaces like Alzheimer's, cancer, and many more to come. And you will see the estimation is that by virtue of doing a lot of AI-enabled target discovery, companies are beginning to optimize time and, more importantly, optimize cost about 30% in that. And some of the other companies like Pharma AI also use tools to optimize clinical trial. Because one thing is very clear, that the amount of money the companies spend in developing a drug is increasing, and therefore there is a need to actually improve and optimize that and get medicines faster to market. So as much as we can use AI to reduce target selection, identify the right sites, and automate the protocol and documentation, that is where the future will be. So this is what some examples here tell us how AI is used. There are links provided. Feel free to go ahead and read more. Next one, please. One slide back. Yes, thank you. And this is not just theory, this is actual reality. So I didn't know this myself before I used AI to find this. And you must do it yourself. There is a molecule INS 18055, which is actually fully AI discovered and now has started phase 2 in US and China for pulmonary fibrosis. And this company is in silico medicine, a very digitally savvy clinical biotech based in US. And they use AI to develop the target, identify the target, then develop chemical and biological molecular structures. And then they now want to start the phase 2 trial, for which they have got approval, and they have also been granted the FDA orphan designation. So I think we are going to watch this molecule and see if AI actually translates into human efficacy. But this is something that you all must also closely follow and keep learning. The next one. Now we move on to how do we design clinical trials and become smart in that. So we are still with the smart theme, if you remember: smart, personalized, and scale. Now imagine that a molecules from AI get into the clinical stage. And here again, there are two examples. I will focus on example one. Imagine a large pharma company now wants to conduct a randomized clinical trial in a rare disease space. Now, all of you are aware that in a rare disease, there are very obvious challenges. One, because it's a rare, you find difficulty in recruiting. You do not want to have a higher sample size because they will take a long time to get to market. And in many cases, in many big pharma companies, you will see that they are developing very similar disease areas. So they want to be the first to market and make that medicine available to patients and also make revenue. However, when you design smaller trials, the challenge is that the health authority may not agree or the reimbursement may be difficult. So what is one of the pharma companies is doing is using AI, and NLP is natural language processing. So in a way, they're doing things to optimize their patient. So they're analyzing the electronic health records, genomic data, and evidence, which is available in registries, to see which are my eligible patients who can be on my trial. And they're using advanced statistical methodologies, leveraging AI to estimate what should be the treatment effect. So most of you know that in clinical trial, we test the difference between treatment and the standard of care, and you power the trial to estimate the treatment effect. It is therefore these AI technologies that help us estimate that better, because we will use a smaller sample size and we will use a lot of real world data to bring it together. So this is how AI, machine learning, and natural language processing is being used to make our trial sharp, small, and yet approvable by health authorities or acceptable by authorities like FDA. So I would encourage you to also read the example number 2 and learn about these technologies as we move forward. Next slide, please. Now we come to personalized section. So here's an example from Germany. University of Leipzig is in Germany, and they have partnered with Janssen, a big pharmaceutical company. And this is how personalized medicines are being now offered with the help of machine learning and AI. So what is this in very simply is the healthcare, as in the KOLs or the health experts, they use AI to scan through guidelines, to scan through personalized or patient data. They look at what past clinical experiences or case studies other doctors have it, and they also are able to use a lot of literature, say PubMed or any other index journal, and see what is the best treatment. So imagine, currently most of the doctors refer to the guideline and their clinical experience. If you augment that with what other doctors are doing, what other literature is saying, and what is historically the patient record, then your decision making to offer a treatment to patient becomes even more sharper and more personalized. So what it does is allows the right medicine to be given to the right patient, and thereby reducing the risk of medicational errors or oversubscription or overprescription. It is currently being used in hematology, and the more they use this, the more the AI trains itself and becomes even better. So another very interesting example of personalized medication, and it's growing significantly. Next one. Now I come to a bit of scale. How is AI helping companies like big pharma companies scale and predict? So it's more towards future. So as you see, as you probably remember in the first chart, any medicine that we develop in a big pharma company, we need to have a price and we need to have somebody pay for it. How do we know what price will we get? And how do we know how best can we win in tenders? I'm sure you all are aware of the tenders that happen in the state governments in India. So here are some examples. I'll highlight just the two I have highlighted here. So one of the companies has a platform where you can predict about 90% accuracy, what likely price will I get? What likely questions will I get from the reimbursement agencies? And what data should I have to justify the value of the medicine that I'm bringing? HTA means Health Technology Assessment, which is reimbursement. Another interesting element and how AI is evolving is now globally, there is a lot of importance on ESG, environment, social, and governance, which means as a manufacturer of a medicine, the more value I place on good environmental practices, the value I place on social benefit and good governance, I am more valued as a manufacturer, and I may have a higher chance to have my medicine win a tender. So there are platforms that actually use these insights, help companies prepare their tenders accordingly, and therefore improve a chance. For example, to give you very simple, there was a case study, a company with a carbon neutral manufacturing of an inhaler with recycled material had won a tender in UK by virtue of reducing the carbon footprint. So that is where ESG, by virtue of saving the environment, helped them win the tender, even though from a clinical efficacy, they were roughly similar to the others. So this is where AI is helping and improving the chances of success. The last one, the next slide, please. And here's another example of how AI helps into market shaping or policy shaping. I was amazed by this fact, and I want to share with you, and you all must go back and find this. How many of your parents have had cataract, and how many of your parents have had cataract surgery done covered by insurance? If you were all on screen, I think 90% of you would have raised your hands. You will be surprised, cataract was actually not covered by insurance till 2010. It only got covered thereafter because the private insurance in India started to look at what does the treatment cost and how can we cover it. And if some of you who follow ophthalmology, you will see that retinal disorders like macular degeneration are also now covered. So what do? They look at real world data and they use AI to see what is my total procedure cost, how much doses does a patient need, what is the likely event in a population of say 100, how many people will get it, and all of this helps the insurer estimate the cost. And basis that cost, they calculate their premium, and that premium then is added to the insurance policy. So if you pay that premium, they will be able to cover the cost. So it is the data that is analyzed, actuarial estimations on what is the likely risk, and that allows them to cover for your cost. So very interesting field, very rapidly growing, and therefore it will be actually the future to go. And I think last point I will come here is on the last bullet about preventive healthcare. If you could stay on the slide, just one slide, please. So yes, I think we will cover this in the panel too, but it is, we have so far been in the preventive care, in the curative space. Now is the time to get into preventive healthcare. What I mean here is, I'm sure a lot of you are wearing a wearable, or you do exercise, or you do gym. Your healthcare insurer is actually watching that. It will only be a matter of time before they will start incentivizing you that, let's say, if person X does 5 days of gym versus person Y who eats pizza, burger, person X is likely to be more healthy, therefore have lower healthcare cost, and I will give him a better insurance premium. So this is where your data through your variables, through your social media is being used through AI to give you benefit. So last slide then. So what are the takeaways? So I think I mentioned smart of how AI is used to develop, personalized, and scale. And therefore, it is only a reflection to how we anticipate the AI to grow at about 27% in the next 10 years. There is already, if you look at pharmaceutical companies, companies who invest in AI or have partnerships with tech companies are highly valued. As Professor Gupta was highlighting, there is an expansion to inventory demand management. So encourage you to look at that space and build that knowledge. And it's not just that the AI is used by companies independently. Regulators, healthcare authorities, and even reimbursement agencies are beginning to value the value of AI, and they will become integrated in the months and years to come. So all in all, keep learning this space, acquiring this skill, and become yourself. As they say, AI will not take a job, but you will be the next person who will replace somebody who doesn't know AI. So with that, I'll stop and hand it back to Dr. Vikas. And
yeah, so thank you, Barun. And it was a triggering talk, and we learned a lot and how we can practically implement AI. Obviously, we understand that, you know, we are going to implement, people are already learning the AI. And definitely, so a futuristic approach should be there, that we should develop a skill to utilize the AI. And it should be taking, like, as you say that, you know, we wanted to develop the technology for India and based on Indian scientists. So thank you very much for, you know, joining and motivating the, you know, young people for future. Thank you very much. Thank you. So now I request Dr. Puneet, you know, as you know that he's from AIIMS Rishikesh, and he's an associate dean, and also he worked on you know, pharmacovigilance, pharmacoepidemiology, and clinical pharmacology, and especially he developed, you know, the new technique or implementation. So we'd like to learn from you about how you implement in the tertiary care centers. Over to Dr. Puneet. Yeah, go ahead, please.
Thank you, sir. Thank you, Dr. YK and sir, for giving me this opportunity to speak on this platform and on the topic of which is primarily related to stores and inventory management. How AI can help in or database inventory management systems can help in improving the healthcare, making it more available and affordable, and can help in management and the budgetary plan. Please, next slide, please. Now, what is usually the process of delivery of healthcare is, first is a prescription is written by a physician, which is usually not legible to everyone. Only who can understand this fact can understand what is written. Cannot be, it is usually not understood well by the patients, and definitely in many situations it is not understood well by the pharmacists who are actually going to dispense the medicine, leading ultimately to a lot of medication errors, poor patient compliance, and poor therapeutic outcome, which ultimately adds to the cost of the therapy. So if we do a pharmacoeconomic analysis, it adds a considerable budget cost to the whole process, just because prescriptions have not been written in a legible way, or they have not been transcribed in the right way, so that it can be utilized properly. Next slide, please. Now, where database inventory management platforms can be useful. The first thing where they can be useful is to understand the drug use patterns. Now, once the data has been digitized, it is available for a lot of analysis, and over a period of time, as more data becomes available, predicting outcomes becomes easier. So drug use patterns can be identified once the data has been digitized, and it can identify overuse or misuse of a certain group of medicines, or it can definitely be used to assess the use of the drugs of interest, like in oncology, monoclonal antibodies, or in immunology, it could be IVIG or many other costly medicines, which can be a topic of interest. Additionally, data on antibiotic use and surveillance and stewardship practices is paramount, can be very helpful in managing or reducing the burden of antimicrobial resistance, which is actually a concern, whether we take it in the terms of the drug development or whether we see it in terms of utilization of the therapies. So antibiotic use and antibiotic resistance is an area which needs to be looked into specifically. Then it can promote data-based inventory management platforms, can be helpful in promoting rational use of medicines by and integrating it with good prescribing practices, where appropriate medicine is prescribed as per the guidelines and as per the evidence-based protocol, like we discussed in the previous session about CADE technology, which is actually used for prescribing the medicines for a patient, and totally AI generated, the prescription is generated through AI. Next slide, please. Then how it can use in management or inventory management. Once we have the drug use pattern, we can plan the drug procurement. Inventory management tools, which are primarily currently dependent on human intervention, can be automated completely. When a drug reaches a low level, automated generation of purchase orders or automated indenting can be done. It can be useful in optimization of resources, where sometimes the purchase is in excess. For example, when we have monsoons, we purchase or anti-snake venom, and the snake venom is purchased in excess at that point of time, but it is not utilized, and sometimes there is a shortage. Then seasonal variations in requirements of the drug can be forecasted once we have the data over a period of years to months, where preparation for dengue, for example, it is dengue, or for example, preparation for malaria can be planned in advance and automated in an automated way without involving any human intervention. Then finally, intervention management in situations of crisis can be improved. Next, how data management based inventory management systems can be used in terms of the market research, where we do a brand analysis. Although governments do not prefer brand names, they prefer drugs with generic names, but they can always be used to identify how the prescribing is being done. Then pharmacoeconomic analysis can be integrated into the AI-based system, cost-benefit analysis, cost-utility analysis, and lots of other analysis can be done in terms of economics, where the cost of different brands to the utilization and ultimately to the efficacy can be integrated. And then we can have a discipline-wise use of medicines, whether it is from the essential medicine list of essential medicines or not from the list of essential medicines. Next slide, please. Then for policy research, academic exercise, it is a very good tool. Database inventory management system platforms can be used for that. Then medical education. And lastly, when we talk about health insurance, we briefly touched that health insurance plans in the previous presentation. Once the risk has been assigned to a particular individual, health insurance schemes like Ayushman Bharat or other government health schemes, they can significantly, their efficiency can significantly be improved if we use database inventory management platforms, where the prescription of an individual patient is linked with the consumption and the issue of the drugs and issue of the whether it is surgical consumable or whether it is of a drug. System can be made totally transparent, accountable, automated, without chances of any human intervention. But the first step, again, for achieving all these goals is digitization of the prescriptions, which is the common, which is a weak link in the whole process. Next slide, please. This is where the database inventory management systems can work, and how simple they are to use is, first is a common used platform which is accessible to public, like WhatsApp can be used. From there, the data is transcribed by AI-based systems, refined and verified by human intervention. And then once the data is digitized, this data can be shared with the patient, a pharmacist, and additionally to the stores, where all the things are integrated. The prescription for the patient is prepared by the pharmacist, and patient comes to collect that particular prescription of, or whether it is a group of patients, it can automatically be prepared, and it will reduce the use of manpower to take the prescription from one place to the other, or to pack the system. And if we integrate data management system or AI-based tools in the pharmacies, like it is currently being done in a good number of developed nations, we can totally make this process human intervention free, which is definitely going to eat up the jobs. Definitely may not be a reality, and we do not have the infrastructure currently to do that, but that is what we see is as a in future, where digital pharmacy or virtual pharmacy or AI based pharmacies are managing everything, and there is an AI based system which is involving after once the prescription has been written. Then next slide please. Now these are the different types of analytics which can be run on the once the data is digitized. There can be prescription information, there can be integration with the medicine database, which is inventory, and from inventory the drugs is prescribed. Automatically the amount prescribed or the dispense is removed, deducted from the stores, and other analytics are run whether about the prescribing patterns. Next slide please. And there is no attendant which actually takes up the, or there is no manpower which is required for taking up the indents or the from the prescriber to the stores. We are reducing the use of human intervention and the cost of salaries, and again that has been reduced between from prescription to the delivery. Next slide please. Now, again, what we are seeing is the different types of analytics which can be run about antibiotics, whether NLEM, whether IV, rational use of drugs can be prescribed. And once rational use of drugs is promoted, automatically it is going to bring down the cost. But the primary, next slide, please. And next slide. Yeah. And then again, it can be a real-time data which we are going to see. Which drug is going on, is utilized currently, or which is being utilized more, and what is the status of the inventory. Automated purchase orders can be generated, and which do not need verification, or just since this is all database, so it can automatically go to the selected vendors, and this is going to significantly reduce the turnaround time from generating the request to ultimately drug being delivered into the pharmacy or the system. So significant reduction in time can be achieved once we have these automated data management systems and AI-based tools available available with us. Next slide, please. And again, this is again one of the analytics. Next slide, please. And these are all analytics which can be run. And that is the end of my presentation, where take-home messages. Once we have data-based inventory management system which use AI-based learning and AI-based tools and machine learning, we can definitely increase the availability of the drugs by reducing the turnaround time. We can reduce the cost of the process by reducing the wages given to the persons, and by promoting rational drug use, whether it is antimicrobial use or antimicrobial use of antimicrobials or other drugs as and when required, or the costly medicines, and we can generate data from them by integrating it with the other guidelines. So it has got a huge scope, and we are expecting that in next decade or so, this is going to take over a lot of inventory management process through digitization. Thank you.
Thank you, Puneet. And can I request Pradhanji to call for the speaker? Yeah, thank you.
Thank you, Professor Puneet, for your insightful talks on how actually the data-based inventory management can be useful in, ensuring rational use of drugs and reducing antimicrobial resistance, planning for drug procurement, and analysis of NLEM, non-NLEM medicines, also how it can be useful in medical education, healthcare, health insurance management, etc. So we have learned a lot of things in this regard from your talks. Now I will request Dr. Sonia Shinde Muazzam ma'am to give his insightful talk on digital platform for prescription analytics as a tool for rational therapeutics, improving patient adherence and reducing medication errors. Dr. Sonia Shinde Muazzam ma'am is Assistant Professor and Head of Department of Pharmacology, AIIMS Jammu. So I request, yes, Dr. Sonia ma'am, please.
Okay, a very good afternoon, everyone, and thank you, Pradhan sir, for the kind introduction. So it is first of all a privilege and honor to speak in front of all the seniors and stalwarts in pharmacology and medical profession. So the topic which I'm going to speak on is how a digital platform for prescription analytics can work as a smart tool for promoting rational therapeutics, reducing medication errors, and antimicrobial surveillance and stewardship. So, and this I think falls very well within the ambit of the smart medicine initiative, which we are all talking of, which India is taking, and which as AIIMS Jammu, we are also going to taking. So, next slide, please. So I think this is self-explanatory that anything which is smart will be very specific, achievable, timely, measurable, and realistic. And if we think of and actually work towards these objectives, I think a lot of work will be done efficiently. So next slide. So, but what is the need for all of these smart tools? So we all are aware of, being a doctor myself, and I think all of fellow colleagues, we agree that despite our best efforts, I think these are the prescriptions, if handwritten, which are given to the patients, which lead to, sometimes subjective. There is a subjective understanding of all the instructions which need to be passed on to the patient and the pharmacist for dispensing. But as against that, if we go for digitalization of these prescriptions, and if we utilize platforms which digitalize them, I think the information will be more comprehensible and understanding to the patient, and which will lead to better adherence. Next slide, please. So in fact, nowadays we have technologies also which help in transcribing these handwritten prescriptions into digital ones. So this is one of them, which is by Google. And I'm sure there are many others, which it is up to us, how we can adopt, and depending upon the type of institute you're working with. Next slide, please. Then I think this again, so no matter how good a prescription a doctor writes, but until it is strictly adhered to by the patient, I think it won't give the optimal therapeutic benefit to the patient. So non-adherence to any form of treatment is a very weak link in the entire thing. Next slide, please. So we all are aware, and I think with the technology pouring so much into the healthcare sector, that there are many digital solutions which are available. Direct ones in the form of trackable pills. I think each and every speaker has so far mentioned about all of these. That is the trackable pills, wearable sensors, smart inhalers. Then you have multi-dose packagings as well as pill organizers. I think pill organizers, most of us, we see our elderly parents or grandparents do use all of these. Then you have reminders, and you have dispensers and organizers and mobile apps also, and e-prescribing software solutions, which again are largely adopted by institutes nowadays. Next slide, please. And indirect ones also, so in the form of teleconsultation or electronic prescribing. Then clinical decision support systems for prescribers. This is again one thing which can, because if the data is in the digital form, I think a lot of work can happen at the back end, and they can be, guided as to how they can make the proper decision regarding treatment or modification of any treatment, right? Next slide, please. Then the third aspect is errors. So again, this is again, it's not new to anyone, but why I would want to emphasize over here is that if even a minor error occurs in either of these things, that is in prescribing or in transcribing, I think I've lost the presentation. Yeah. Or in any, in identifying the patient, in identifying the right medicine which needs to be given, the dose or route or the frequency, not stopping it at the right time, all of these can lead to safety concerns to the patient, as well as hamper the outcome of the treatment. Next slide, please. So all of this actually, and again, there is a systematic approach which can be adopted by any institute for reducing these medication errors in the form of using the best practices for dose calculation and route of administration, then electronic prescribing systems and decision support tools. Then by being vigilant with your medication management, like Dr. Puneet said that, management of the inventory and all that also helps in, reducing the shortage. Then patient education is again very important. So if we have a digital prescription, maybe the patient, a learned person, will automatically can read what is given. But if it's a handwritten prescription, most of the times even a well-educated person is not able to actually comprehend what is written, in case the handwriting is not legible. And then medical reconciliation, again, this is one thing which we may have encountered quite a many number of times. That is, many a times patients, they visit the doctor, but they're not carrying maybe the previous prescriptions of some other doctor. So then reconciling with what exactly he has taken, and treating or writing the further treatment accordingly. Or in fact, in the same institution also, if the person is shifting from OPD to IPD, and then from IPD to maybe the intensive care. So if the reconciliation does not occur at every stage, it can lead to, or polypharmacy or over administration of medicines, and that can ultimately affect the treatment outcome. But with the digitalization or digitalized prescriptions, this is very easy and it is available to any doctor who is seeing the patient. Next slide, please. So this, now we have all have seen that. So digitalization or digitalized prescriptions or digital prescriptions, they will benefit not only just one person, but all these stakeholders, that is the administrators, the clinicians, the patients visiting, even the pharmacist, then the laboratory services also, and any services over the entire spectrum of the healthcare system. Next slide. So it was with this actually that we thought of this initiative at AIIMS Jammu under the leadership of our ED and CEO and our president also of AIIMS Jammu, who have endorsed this thing very rightly. And because I think you all have witnessed the presentation given by our director, Dr. Professor Shakti Gupta sir, who has emphasized as to what the ethos of AIIMS Jammu is, that is digitalization in all aspects, and creating a safe environment. So with this, we had conceived this proposal, and I'm happy to share that we have officially commenced with it since April of this year. Next slide, please. So here actually how it slightly differs at our institute is because as Director Sir has already mentioned, that we already have a hospital management information system at AIIMS Jammu, which is given by CDAC, wherein the various modules which have been shown by our worthy ED have been listed. And we also intend to digitalize the manual prescriptions, because it is, we are, as we said, it's a nascent institute, so this requires infrastructure, but we are progressing towards that, and we intend to digitalize the prescription of each and every patient. And so what are we going to do with this humongous data that we have? Because until it is converted into some meaningful information, it will not help. So we have collaborated with a digital technology platform who will analyze these prescriptions in a very real-time manner, so that we get insights from this information, and we can, yeah, please, next slide. So this is somehow the schematic flow of what we'll be doing in the project. That is, the data will be captured, and then obviously it will be verified by the team of the various teams which will be working on it, so that to see that all the data has been entered or captured correctly. Then it will be standardized, and it will be passed on to the service provider company, that is VaidyaRx, for analysis and for the creation of the dashboard. And it will give timely insights. So actually the dashboard is not static, it is dynamic. Dynamic as in, if we give the details of today's data of all the departments, so maybe within a lag period of 1 or 2 days, this can the dashboard, I mean, all the insights will be available. So this is the representation or the flow of the work, that is the information which is captured from HMIS, that is entered into the Excel sheet, that is the data entry Excel sheet. Then the data is transformed and standardized, and in the form of this visuals. So again, next please. Yeah, so this is the preliminary prototype dashboard for AIIMS Jammu, which we are aiming. I mean, they have made this with a sample or with a data set which we provided, and this should not be, the values are just for demonstration of what exactly can be achieved through this analytics platform, and it should not be construed as original or true and or to draw any conclusions. So you can see that, and this is a real time thing. So maybe after my presentation, I'll give a quick glimpse of it, wherein the departments, so all the departments which you give data for will get analyzed. Then number of patients, what are the number of prescriptions that are analyzed, that is there. Then total number of medicinal items, whether they were prescribed with a brand name, a generic name, and what are the top categories, what are the top antimicrobials. So this is not, I mean, this is what we wanted to see on the dashboard. It can be institute specific as per your requirement, as AIIMS Rishikesh is maybe planning for inventory. We want to start with this from OPD, then we'll go to the IPD, and the departments can also actually, they can give their own requirements for analysis, which they want to get done. So this is actually very customizable and very versatile. Next slide, please. So these are the advantages which we've been speaking of, and a few which we could identify. So, but important is because utilization pattern. If I'm a clinician or I'm heading a department, say medicine or any department, we go to the OPD, we prescribe medicines, we come back. But what is the pattern? What is the utilization pattern of my department? I mean, sometimes even I don't know, because who's going to give me that information? They don't have time. So this is how we can, I mean, the platform can give us insights. Then this utilization pattern can help us in planning of medicine procurement, promote rational prescribing, because if it is legible and if all the fields are filled, then obviously integration with PVPI, again, we intend to do this. That is the data, which is the areas which are reported, we will definitely want to integrate, and so that they reflect on the dashboard as to how much AIIMS Jammu is contributing, and the same can be integrated with the pharmacovigilance program. Obviously, it will help in reducing medication errors, improving compliance and adherence. Again, it will give us some evidence as to what needs to be included in our institute's formulary or the institute's list of essential medicines. Antimicrobial surveillance, again, so not only we want to analyze the prescriptions, but also see how it can, we want to integrate it with the institute's antibiogram. So we can see, exactly how, we can optimize the use of antimicrobials, and then pharmacoeconomic analysis. So this is something which we have identified for our institute, and maybe we would want to achieve out of this in a staged manner. Next slide. So I think a lot has been spoken, but what we have reached so far is just, I think, which we all are aware of, but the world is progressing, and I think technology is foraying and progressing very rapidly. So this is something that is digital therapeutics. So the food for thought of all, for all the listeners, especially the young students who are aspiring and want to do something great. So there is something called as drug and digital combination therapies. That is, and this has been approved by the FDA, where mobile medical apps, they have been approved as software as a medical device, for treating or preventing specific medical conditions, especially the neurodegenerative disorders, wherein as much as the treatment is important, but adherence to that treatment. So the app or the mobile application will help in by giving reminders for taking the medicine, especially when there is cognitive decline. So these are the things which we want to actually, we should strive for, and maybe, try to achieve in future. So that's it. I think I'll stop here, and thank you for your patient listening. And maybe if we can just have just one quick glimpse of the dashboard, because viewing it in 2D is not the purpose until you have a 3D or a dynamic, a view of the dynamic dashboard. So I think, so this is it. So what I would want you to just focus on is that if you change the date of the slider, this is changing. So it's not that it will be, you're tabulating the month's data. This will be as in when the data is analyzed, it will reflect and it will keep on changing. And this will give, this is a boon for the hospital administrators also, so that they can make quick decisions on a day-to-day basis, and especially in emergencies or scenarios like COVID-19, what COVID-19 showed us, wherein you want to take decisions on a day-to-day basis. I think this can help. So thank you everyone, and thank you to the organizers for the opportunity of speaking before such a great audience and in amidst all the experts and stalwarts. Thank you, sir.
Thank you. Thank you very much, Dr. Sonia, for giving wonderful picture of and then giving how the digitalization of prescription and all those things can be so useful. Now, I would request Dr. Vikas, who is the leader in pharmacology, to just give a quick chairman's comment. And then I would request Pradhan, Mr. Pradhan, to give his chairman's comment.
So, thank you, sir. So, can I have a quick, upload of a slide? Maybe I'll.
Yeah, sure, sure. You have already, I think, done. It is. You can move it.
Okay. So we are thinking it's not only therapy, how diagnosis is very important, for innovation, because all of us, we work, and in the world, if you say this is a gray area, we can work on it, So going to the next slide, we have an experience of during the COVID, how we have a kit for detection. So idea is that we have a capability to do it, and we can implement. Like this is one initiative developed by CSIR and Tata One. Then coming to the next one is, if you look at that population-wise precision medicine. Can you go to the next slide? So here you can say that how Indian data can generate, because even if it comes from outside, you need to verify in Indian, is it feasible or is this practically feasible? I think this is one technology that we have already worked on it, and it is going to implement, and it can be easily implemented. Now coming to the technology, like already Borun had a detailed discussion. Go to the next slide. And this is how we have to look at. Like we have a policy in the hospital keeping the data, OPD 5 years, indoor 10 years, medical legal lifelong. But this also should have an uniform for all the hospital, for a government and private hospital, and so that we can utilize the data for practical implementation. So third thing is, we look for a new technology. Go to the next slide. We work for patient safety. We had already a couple of meetings, and we are coming up with a guideline also. So definitely all this cutting edge technology need to be implemented for India-centric one. So I thank Professor YK Gupta, and definitely this is a good initiative. I thank the YKG Academy, my mentor, and definitely we can do, and we can change the country in future. We can contribute from our group. So thank you very much.
Thank you very much. Thank you very much, Dr. Vikas, for inspiring this young generation. And I like the clinicians meets AIML. AIML meets clinicians. I think that's changing concept. Now, Mr. Pradhan is the most learned regulator in the country. So his comment on this, particularly the reference to the AIML, digital, and all those things. Pradhan, sir.
Yeah, thank you, sir. I think in this panel discussion, we have basically have insights on three aspects. One is AI and real world evidence in the drug development, and also how data-based inventory management and digital platform actually can bring solution in ensuring patient adherence and medication errors, etc., and also the details that has been actually covered in Barun's presentation, basically, that how use of AI and real world evidence can actually brings many solution to various challenges in drug development, specifically in rare disease, and also to get treatment effects and personalized medicine targeted therapies, and also how to optimize price negotiations, and using AI, how to save the healthcare private market also. So, in out of these three things, in my opinion, digital platform is being used heavily in healthcare system, almost in all, in all areas in healthcare system. So far as AI and real world evidence is concerned, I think these two things are emerging issues. And although the country like in USA or European Union and other countries, they are little bit more ahead in terms of adopting such practice and encouraging the research and development in these areas of AI and real world evidence in healthcare system overall. So, but in India, I think we are yet to actually take the steps in a very large way and adopt such practices to address many challenges in healthcare system. And I think, as Professor Gupta has rightly mentioned, that smart medicine covers a varieties of multidisciplinary areas in all spheres of life, and more specifically because we are in part of healthcare ecosystem. So far as its usefulness in healthcare system is concerned, these are very important, from starting from innovation of drugs, therapies, to healthcare services in drugs and diagnostic and theranostic and so on. And also use of AI and real world evidence in regulatory decision makings, because as the science and developed technology is being advanced in a rapid way, I think we all have to update our skills. We have to adopt such practices in every stage at regulatory levels, and so also at the policy makers level, and not only in cases where we actually provide the healthcare services. So in this regard, as YK Gupta also has mentioned about blockchain technology, that is a technology which is used in every spheres of life today for various authentication and tracking and tracing system. So in our regulatory system also, we have a regulation that the first 300 top brands of medicines are required to be labeled on their label with QR code or barcode for ensuring authenticity of the medicine, to prevent such medicines from counterfeiting. And there, although this blockchain technology and QR code are two distinct technologies, but there are various talks and also various papers available which suggest that combination of blockchain technology based QR code, combination of blockchain with QR code, is actually probably the most robust system or robust technology based QR coding, which will actually prevent that counterfeiting, and also it will prevent further copying of such coding, QR coding. So that is another area of the things. So I think all the three speakers in this session have actually given their trigger talks, and we have learned a lot in all these emerging issues. And we hope that this type of events and webinar will be actually organized in future also, because India as a country need to do a lot in terms of use of AI and real world evidence for the benefit of actually public. So with this, I think I thank all the panelists and all the participants here, so far as this panel discussion session is concerned. Thank you.
Thank you very much, Mr. Pradhan and Dr. Vikas, for giving wonderful comments. And I am getting some questions from the audience, wonderful questions on the comment on doctors for pharmacy and the psychiatry and the reliability in the psychiatry. These are very important issues. And I would just say one thing. Please do post us your comments, and we will have a special session to address this. Maybe in the next 15 days, all those questions which you will raise, we'll put it. Particularly, we want to address those issues which are pertinent to Pharm D students and pharmacy, because I personally and with my colleagues at the helm of affairs are keen that our pharmacy education, particularly M-Pharm or Pharm D students, should have the education which is contemporary
Sir, check the audio, please. Sir, ka audio check.
Sure, sir. Just a minute, sir.
system. I would say smart air defense system. And we could penetrate because of the smart air defense system. So this is something we are working on. So now with this, I hand over this to the next panel of Chairman Dr. Satyajit Mahapatra, and who is the head of Department of Pharmacology at AIIMS Guwahati, and was you can see his extensive profile, and he is the champion of clinical pharmacology, did so many trials. And also I will give it to the co-chair or the another chairperson, Dr. Pooja Gupta. Dr. Pooja Gupta is in charge of the entire computer section of AIIMS, where we have 500 faculty and more than, I think, 15,000 computers. And you must be knowing that the computer of AIIMS was hacked some time back, for which a huge amount was asked as a ransom, and which Dr. Pooja handled so well that we did not pay a single money for that. And she is a pharmacologist, professor of pharmacology. And Varun Gupta, who just addressed, will moderate this session. So now over to Satyajit, Dr. Pooja, and Varun. Over to Satyajit, are you there?
Yeah. Good afternoon, everyone.
Varun, are you there? Varun, Satyajit, and now all to you.
Yeah.
Thank you, sir. Thank you, sir, for the introduction. Am I audible, sir?
Yes, you're
Yes.
audible.
Yeah. Thank you, sir. Thank you. Good afternoon, everyone. It's a pleasure to welcome you all to this panel discussion. We have trigger talk followed by the panel discussion. We are going to discuss about smart diagnostics, ingestible sensors, smart pills, which are revolutionizing how to detect, monitor, and manage disease. It's a very good program that has been designed. We have 3 engineers here and 1 doctor in this program. This presentation will definitely showcase a groundbreaking technology, and this will empower the clinicians in smart decision making. So I expect that this will be a engaging session, and look forward to the session. The first session by Professor Ravi Kumar Elangavan, who is a co-founder and chief innovation officer of IIIMS Innovation Private Limited. He is a biochemical engineer from IIT Delhi and has been involved in many diagnostic and medtech products development in India. So it is my pleasure to invite Professor Ravi Krishnan. Over to you.
So thank you. Can you hear me?
Yes, Dr.
Yes,
Ravi.
we can hear.
Oh, perfect. So first of all, good afternoon, everyone. So I like to thank Professor YK Gupta and this YKG Academy and VaidyaRx platform to share some of our thoughts on this smart medicine and how diagnostics is shaping also this medicine therapeutics in India. I think one of the message was Professor YK Gupta's that as the technologies are rapidly accelerating, we should not be left behind. We should actually aspire and be ambitious in our own pursuits to improve the healthcare delivery. So in that way, I like to share some of our understanding about this area so that this can actually trigger some ideas and thoughts around this one. Now, the medicine delivery has been actually traditionally based on symptoms, and which we have actually relied from very experienced people looking at it. But this paradigm shift is happening where the symptom is basically we are actually accurately judging based on the signals. Now, this is where that smart diagnostics is also combining for a better healthcare delivery today. So next slides. So if you see today, our understanding on biology of various disease models has improved. So today we have a much better understanding of biomarkers, that is causative for infectious disease, likewise also all non-communicable cancers. So we know various different proteins and DNAs which are actually responsible for diseases. So now we have also very high throughput technologies that is allowing us to basically look at this biomarkers, be it protein, DNA, and the data is available for us to look into various kind of disease status. Now, along this direction, we are actually having the digitization has happened. We have been hearing a lot of digitization around the prescription, even the drug development. Now, the data on the individual biomarkers and the behavioral and all types of heart rate monitoring, these are all getting digitized, and we are having a huge amount of data that is not traditionally visualized or easily interpreted by us humans. So this is where we are seeing the advent of AI happening in a very big way. So I'll also touch upon how AI is basically helping us to interpret this large amount of data. The third interesting thing that is happening in this diagnostics domain is actually we are now realizing that diseases are very unique at an individual level. So the particular person with a particular genetic makeup, particular biomarker, metabolites, all are actually having a very different behavior when it's coming to the treatment of diseases. So this is where that every individual data is also specifically looked into, and this is leading to a lot of unique way of treating diseases that has not been previously possible. So the diagnostics is not just at one single point where the disease is being identified. So now the diagnostics is basically also taken all along where the treatment is going on, where you can actually look at whether the particular treatment is effective, you are actually recovering the biological potential, and all this prognosis and monitoring is also happening along. So this is where we would like to actually learn and use our diagnostics also smart so that we can actually deliver a better healthcare solutions. Next slide. So if you see, the diagnostics can actually influence almost 70% of the clinical decisions, though it's only 2% of overall expenditure that is happening. There are some fields where we are having very strong dependency on diagnostics. For example, infectious disease. We all have experience from the COVID. So confirming the COVID is using an RT-PCR has been one of the main important tool before we can actually have any kind of a treatment can be done. Likewise, many diseases, TB, malaria, the drugs are so heavy on the body that you would like to have a diagnostics confirmation before you can actually start the treatment. Likewise, today in oncology, you are having this possibility of identifying the personalized, what is the genetic profile, and based on that treatments are being taken up. A lot of lifestyle diseases where you are monitoring the glucose regularly, your biomarker like HbA1cs are monitored to administer different kind of therapies. So I think we are hoping that the diagnostics will continue to grow and it will help into shape the more better quality of healthcare delivery. So next slide. So there is another interesting trend that is happening, that is these diagnostics so far has been very traditionally stick to a tertiary care settings. But now these diagnostics technologies are actually moving to our living rooms. So for example, personalized glucose meter, everybody is familiar, where we are actually able to measure the glucose at our home with a small fingerprint of blood. Like this, a very large number of diagnostic tests are actually getting towards close to patient, close to the user kind of level, where you are able to generate a lot of data around a specific biomarker close to the patient. And these data are now basically clearly recorded onto the cloud platform. And this cloud data is allowing this same data to be reviewed not just only by the physician who is close by, but also physician who can be far away. So this data integration, data into the cloud is also significantly changing the way this health interpretation is happening. So next slide. So I'll talk a little bit more in depth about the precision medicine. This is a one field I think we have to actually have a significant contribution from India, where the diseases like cancer can be has a multiple level of challenges. One is, can you identify, early diagnose this cancer? The second one is basically, if you have a particular cancer, can a right kind of a treatment can be identified? As the treatment is ongoing, can we effectively monitor so that there is no relapses happening? So this is where this field of liquid biopsy is emerging, where you can actually look for small DNA fragments of this cancer cells floating in the blood. Now, these small DNA fragments can be isolated. Then you can actually sequence these DNA fragments. Now, based on the mutations of these DNA fragments, one can identify what type of mutation that is tumor is persisting, and if there is a targetable mutation. So that means you can also identify a particular therapy. We were discussing about EGFR. You are actually also possibility of HER2 is another particular type of subcancer. Once you are able to identify this subcancer type, you will be able to prescribe a right kind of a treatment for the person. Again, many of these diseases, as you take up a surgical or even an immunotherapy, you would like to identify whether the disease burden has reduced and the patient has recovered fully. So this is where we are also seeing the liquid biopsies helping to identify something called as a minimum residual disease, MRD. So you can actually monitor some of the presence of this cancer or pathogens in the blood as the treatment is ongoing. And this can be actually used to tailor the therapeutic outcome. Next slide. Now, adding to this personalized medicine, today the AI is actually coming in a very, very significant way in the diagnostics help. So we work on specific, some of the diseases like cervical cancer, pathology, where a lot of microscopy data is generated. Now, this data is actually in very large volume. If you ask for a human to evaluate and look for a particular type of patterns, the time is very significant. So by the time you are evaluating these things, 10-20 minutes, fatigue sets in. So this is where these AI-based diagnostics are really, really turning, because they can actually analyze a very large amount of data in much shorter time spans. Now, over the time, these models are also getting better and better. Now we are actually having many good models, which are actually at most as good as a human interpretation, some of our best experts. Now, this is where it is actually adding up to a unique value addition, because the places where normally these kind of experts will not be available, suddenly they have an access to interpretation based on these AI models. And this can basically happen for multiple number of diseases. You don't have to rely on one expert. And this augmentation of interpretation is going to help us to deliver a very high quality diagnostics in a deployable way. So again, this is actually increasing the reach of the diagnostics, which is currently limited because of experts availability. Next. So there is this last part where we are actually seeing that a lot of interesting therapy-based diagnostics, monitoring-based diagnostics also being available. So we are all familiar for HB1A. So where you can actually monitor how the diabetics is under control or not, right? So we have actually some studies going around on neurological diseases like schizophrenia and Parkinson. This is a dopamine dependent disease. So you can actually have a high dopamine or low dopamine. Based on this, you can get into one of the disease conditions. Again, it is very difficult to assess based on only symptoms. Now there are very clear biomarkers identified in AIIMS Delhi. Now you can actually look for this biomarkers quantity in the blood, can clearly identify whether the patient is more towards which disease. Accordingly, the treatment can be tailored. So again, a continuous monitoring, a clear picture of what is the health quality of the person can be assessed for tailoring the treatment. Next slide.
फ्रीज हो गया ये हमारा फ्रीज हो गया उधर
नहीं सर उनका फ्रीज हमारा तो चल रहा
is Dr. Ravi. I think there is some internet problem with Dr. Ravi's network.
Yes, sir.
It seems.
Yes, sir.
Okay, so Dr. Ravi's network is till it resumes. Satyajit, with your permission, I will ask all the audience which is listening very carefully. Please raise your hands, both hands like this. Quickly, please raise your hand.
You on करके.
Everybody, please raise your hands quickly like this.
Everyone,
and then put your both the hands on the eyes for 2 seconds, 5 seconds like this. You've done that?
Yes.
And now you clap 3 times. Now you are ready for next half an hour. Okay. Over to Ravi. Are you again back?
Sir, I'm back. I think
the time we have used this time.
Yeah. So I just would like to bring that attention that much of our diagnostics is concentrated around tier 1 cities. Now we would like to actually, when we are aspiring to improve the smart diagnostics, smart medicines, that we should actually prepare and use this new technology adoption to give an equitable diagnostics across India. Next slide. This is where a lot of interesting activities are happening, that this point of care diagnostics have a possibility be having a lower capital requirement for a deployment. Now, Government of India has actually have a huge ambition to set up this labs based in AIIMS Bharat scheme to block level and district levels. Today, all of this data is getting connected under the National Digital Health Mission, so that we can actually use this for actually digitization of our data and also use that for our better interpretation. Now, one of the point I would like to add is that all of these things, we also need to have a robust public-private partnerships. In Indian healthcare system, we have a lot of strength in the private sector, which can be augmented to deliver a very high quality solutions for in India. So next. I just want to add one point for us to think about it, so that next time when we meet, we can actually learn a little bit more about it. Today, the diagnostics and law is only limited to certain sections. For example, the notified diseases like TB, HIV, malaria, we have definitely a requirement of a diagnostics. Whereas some of the Schedule H1X drugs, there is a diagnostic is advised, but it is not a mandatory. We have looked at a lot of antibiotics prescription. Again, we are actually closely monitoring how the antibiotics are prescribed. Again, we are hoping that the policies might incline towards a inclusion of diagnostics as a legal requirement. And many of the medical negligence cases also are looking at whether diagnostics was used at appropriate time for basically requiring a particular treatment. So this phase is emerging and has a lot of potential, and we would like to use it to make a very good healthcare system for in India. So with that, I like to thank for you all for your attention and time.
Thank you, Professor Ravi Krishnan. As you mentioned, how the precision medicine starts or begins with precision diagnostics, and how the diagnostic, like smart diagnostics, are enabling rapid and accurate decentralized testing in the clinics or remote areas. Definitely in setups like India, it is going to help, and looking forward for more and more development of these smart diagnostic tools in future. Thank you once again. We'll go to the next session, Trigger Talk, by Professor Joshi. Professor Joshi is a former, KP Joshi is the Dean and Principal of SBS Medical College, Mehboob Nagar, Hyderabad. He is a former fellow from the PhD Institute, Coimbatore, and has a 22 years of experience in teaching, training, and research. More than 50 plus research publication, and he is a very learned person and has done this prescription analytics at his institutes along with his team. So we'd definitely love to listen to Dr. KP Joshi, his experience about this prescription analysis, digital prescription analysis. Over to you, Dr. Joshi.
Yeah, thank you, Dr. Satyajit. I hope I am audible.
Yeah, you are audible.
Yeah.
Please carry.
So good afternoon, one and all. It's a very nice occasion for me to speak in front of such august audience and the organizer. First of all, thank you very much for Dr. YK Gupta sir for making me the part of this program, and thank you VaidyaRx. So I am going to talk about experience. Okay, it's not like anything which is related or written in the book. It is all what we experience in LPS with the collaboration of VaidyaRx, which is here. I think Mr. Tarun Gupta is here, who is the CEO. We collaborated 1 year before. So I'm sharing SBS experience in digital-based prescription analysis and its usefulness. Next slide, please.
Dr. Joshi, I think you've gone mute. Could you please unmute yourself?
डॉक्टर जोशी आपका म्यूट हो गया, उसको अनम्यूट कर लीजिए.
You are not audible, Dr. Joshi.
Yeah. So we met somewhere, and then we were thinking about it's a 26-year-old institution, SBS Medical College, which is 1 hour away from the Hyderabad city, and we are having 150 seats of MBBS PG seats. And during the course, our management, especially Mr. VaidyaRx sir and all the Reddy brothers, were interested to do something on AMR, because we were already working on one multi-centric project on AMR in our institution. Then, luckily, we came into the touch with Dr. YK Gupta sir and Mr. Tarun Gupta. And we found out that something interesting which can be very useful for us. So the journey started in the May from 2025, and so last 1 year we are working together. In this one, we thought that how to start our work. So we focused like we should do the digital, analysis of our prescriptions, focusing on AMR, how they can help to us. And in more than 9,000 OPD and more than 2,100 IPD prescriptions we have captured. And mostly we have taken not from the whole hospital, only from few departments like general medicine, general surgery, orthopedics, pediatrics, and pulmonology. Why we have done so? So the key objectives of this whole project or the whole exercise was to promote the rational drug uses in the system in the tertiary care center level, to increase the general prescribing. As you know, it's not that much in the private institutions. To increase that usage, to enable effective AMR surveillance. That was the main aspect to bring or this project to in our institution, and to reduce the inappropriate polypharmacy. That was the very also useful thing which all already might have spoken about it. And to minimize the medications error, whether it is the doses, whether it is talked about number of days, whether it is anything which is related with the combinations, whether it is handwriting or something, anything which is causing the error. That is also we wanted to minimize it and improve the overall prescribing practice for the benefit of the definitely for the patients as well as for the institution. So with these aims, we started this thing. Next slide, please. We started our journey. We had a lot of brainstorming, discussions, meetings put together with both the teams. Both the teams worked very hard for that. At the end, how it worked. So the data which was just discussed, it is purely a mobile-based app. I think so. Next, Tarun will be talking about it. It is a simple, a very useful, very user-friendly mobile app by which the patient will have, the doctors will have, and the pharmacist also will have. Even the lab technicians from the lab department will have. And once they will register to it, they will come to the for the doctors, and whatever the doctor is writing prescription, you can see the first thing. Please go back. This slide only. You can see the first slide. You can see the first one. So the prescription is written, that's called data. Okay, so the data, suppose I am a doctor, I have written a prescription, and the data is captured by this thing, and it has been sent it to the pharmacist. That pharmacist already, it not need to send, automatically he will get it, and he will prescribe the medicines accordingly. This data, it will be in the cloud, and it will be the data processing will be done. You can see how everything will be registered, whatever it is, whether it is age or sex or name or whatever the diagnosis, whatever the disease, drugs, whatever it is written in this prescription, even the digitalization of the prescriptions is also the option for that. So such a wonderful things after that you can see, and then the analysis starts, and you can see the last column by which if I just enlarge a little bit, you can see that you can get all the details, whatever you need, you can pick up from there. You can see how many numbers today, how many every week, every monthly, every thrice a month, or whenever you want to see, you can see on the dashboard is the magic. You can see how many patients has gone today, how many patients has come, what has happened, what medication prescribed for them. So you can see the wide range of the data, which you can utilize in all the ways. And you can say utilize it every place, wherever you want. You can see the number, like overall number of prescriptions, overall the drugs prescribed to them, which were under LEM, whether were not LEM, whether were from WHO criteria, whether from not WHO criteria. So all these things were analyzed very clearly, very effectively, and very precisely by the team, the VaidyaRx team, on the digital platform, and dashboard was allowed to us. So we were also monitoring it. Next slide. Just in summary, if I say that in last 1 year, just if you can see the first one, around more than from these 8 departments, few those who are exclusion and inclusion criteria also was applied. So put together around more than 8,000, more than 9,000 prescriptions we analyzed in OPD, and we can see the distribution, the age-wise distribution, sex-wise distributions, or the drugs you can say they were prescribed, and the error happened during writing, like how many people missed the RX symbol, how many people missed the, whether the doses, how many people missed the exact, the capital letters, how many missed the generic name, and even everything. You can see that all this our data is there with us, that what happened, what kind of prescription were issued by the SPS Medical College OPD, and even some in the IPD. So this all data we have analyzed, and we have not only this analyzed, then we have made meetings on that what was the actually lacuna, where was the problem, how can we overcome that. So slowly we became proactive regarding this approach for the corrections, like prevention. Prevention is better than cure, you always say, no? So by this, doing this, getting this analysis in our hand, it was very useful for us. So that is how the analytics went on well for last 1 year. It was in a short, it was too much to tell, but just in a glance you can have an understanding that how the VaidyaRx app can give such a useful information by the prescription analysis. Next, please. Next slide, please. Yeah. So you can see that the benefit out of this analysis, that the clinical benefits, as I told, improve the clinical decisions, patient adherence, care for the better coordinations among the labs, patients, and the doctors, the real-time insight into the prescribing patterns, and the enhanced antibiotic uses, like rather than impairing the using of the antibiotics, evaluations and antibiotic towards the antibiotic stewardship, and the teaching medical students. That's more important for the PGs and UGs regarding the rational usage of the prescription, rational writing of the prescription, moreover, and generating the data for the CME and publication, which we have done. And next slide, I will be showing it. And the third one, at the administrative benefits for the monitoring the drugs consumptions and the claims, like what kind of more drugs are utilized in my center or your center if you use it, and plans for the procurement, the control for the inventory, achieve the substantial cost savings in all the sectors, whether it is in especially in the drugs and the antibiotics, especially in the antibiotics. Next slide, please. Now, importance of the digital platform, what we feel already so many people have spoken more and more about it. I will talk about the practical aspect, what we feel that how it is important for, we felt that it is important. This is like automation, the digitalization of the data. We do not do anything. Data is collected, analyzed, it is kept in front of us. It is efficient, accurate, and it is very useful in the processing and the prescription for enabling the comprehensive assessment of the prescribing practice. And moreover, it is flexible to analyze. No, I don't want, I want only the combination of amoxicillin 625 to whom to is given. Okay, that's what they will tell us to us. No, I want this drugs was given in pediatric age group for how many people? Immediately the data will analyze. No, okay, fine, pediatric. I want the percentage of NSAIDs prescribed in the senior citizens, 65 plus people. Okay, fine. Easily the dashboard will provide to us. So it is wonderful to have the data and all. And transparent and visible digital prescribing data, which influence the prescriber also, and behavior towards like guidelines, compliance for practices, especially if at all related with the AMR, which was our main aim behind taking this right. So for the antibiotic towards the AMR stewardship. Next one, please. And as I told you, so much data has been generated to us. So with the combined effort and the guidance and the support of Dr. YK Gupta sir and the team of VaidyaRx and SVS from our pharmacology professors from our side, medicine professors from our side, and myself and YK Gupta sir, Rohini and all the team put together, we have done two publications. One is very prestigious, you can say, which is Indian Journal of Pharmacology, IJP, and then another one is International Journal of Medicine and Public Health. There is also a good journal. So we have published both the articles successfully. They are on our sites. You can see that. There is also one kind of utility or some sort of like a satisfaction that whatever we have analyzed, we have got it. We could publish in a better way. So they are very quality publications. You can see them whenever you can get the time. Next slide, please. Next slide, please. Apart from that, as I told you, that we wanted some sort of stewardship in the AMR. So again, under the guidance, support with the YK Gupta sir and that NAMS also, we had one CME come workshop at SVS in the month of, I think so, in the July, June. And we had the team from there and some of the speakers from here who are Dr. Sonia from AIIMS Jammu. And sir has called most of the people from Delhi and all. Thank you so much for being here with us for that day. And it was a great successful, program. It was a great success. People from pharmacy colleges, from medical colleges, from nursing colleges, all the audience enjoyed this and learned so much from this workshop. So because of this data presentations and with this impact and effort, we had this workshop, which was very useful for everyone. And next one. So what we look forward from that is thank you for everyone for their patience listening. So at the end, nutshell, if I say in the two lines that how was my experience for utilizing digital app, the answer is it was a wonderful experience. It was a great experience. It was so much learning for us. We could learn so many things about ourselves, our lacuna, and we could plan it like now every time after this attaching we had in the meeting every 3 months on this all analytics. For undergraduate students in pharmacology, now we are training properly. Already it is in the curriculum, but we are training more precisely, more effectively. PGs already training are there for them, but we are training them more effectively, showing by their mistakes. And it is very useful for us. It was quite useful for us. And not only for this, this app, this VaidyaRx app can be utilized in multiple ways by depend on your need and depend on your aspects for that. So thank you so much for giving me this opportunity.
Thank you, Professor Joshi. Thank you for sharing your experience at SBS Medical College. I must appreciate your leadership taking up this project at SBS Medical College along with your team and VaidyaRx. Yes, of course, VaidyaRx, the digital tool for prescription analysis, enables the clinicians to take actionable like decision regarding what they're planning to do. And also, as you mentioned, like it will help in academics as well as teaching as well as the administrative decision. So thank you once again. Now I'll request Professor Pooja to take over the session.
Dr. Satyajit. And now invite our next speaker, Mr. G.N. Balakrishnan, who has more than 30 years or 3 decades of experience cutting across pharmaceuticals, medical devices, and healthcare IT domains. He's currently the Director Sales and Commercial Operations for ZOHO Corporation, a well-known Indian multinational IT company. I invite Mr. Balakrishnan to share his experience and vision for smartly reimagining the Indian healthcare system. Mr.
Hi, good evening, Pooja, and thank you so much for giving us the opportunity. Before I kickstart, I take this opportunity to also thank YKG Academy for organizing such a wonderful event, giving the greater insight on the evolving healthcare ecosystem as well as some of the game-changing technology which is getting adopted. So what I'll do in next 5 to 7 minutes is take you through the slide which primarily captures about some of the healthcare initiative which we are doing in ZOHO. As you're aware, ZOHO is a product company been in the existence for last 28 years. Just take the, can you move to the next slide? Sorry. Okay. ZOHO is a product development company which is privately held, been in existence for the last 28 years, and we have 15,000 plus employees, and we have built 50 plus applications. These applications are built across the verticals, could be a sales, marketing, and business application, office suites, and then we've got an inventory and a lot of applications for the businesses. And we operate in 150 plus countries, and our user base has gone up to 100 million users and 750K customers worldwide. So we have our corporate office based out of Chennai, and we spread across the globe. Next slide. Okay, in this slide, I just want to touch on why we are in healthcare. As I said, ZOHO is a product development company having 55 plus application. But I'm sure in this group, people would agree with me. The technology penetration in healthcare is not as what we have seen in the retail or banking. The technology adoption in the healthcare is relatively slow for various reasons. The ecosystem has not evolved, and the regulatory framework have not been evolved to a greater extent, like the developed countries like US and UK. Could be that's one of the reasons why technology adoption were relatively poor. And now the country specific requirement, like every country is looking into the data center which has to be hosted in their respective country because of the data security, right? To just start with this slide, we have got almost 10 data centers across the world, including in India, Saudi Arabia, and then US and UK and so on. So the technology adoption in healthcare was poor for various reasons, and one of this reason why we could not able to penetrate is also the data hosting, right? Now there's a lot of awareness. More and more companies are moving away from US, setting up the data centers in their respective locations. Next slide. Okay, so when we talk about the patient journey in the hospital, or any of those healthcare services, primarily it starts from awareness and ends up in the follow-up and preventive care, more so the continuum of care. And if we were to see the technology adoption in each of the stages, could be awareness. The patient is not aware about what treatment they'll have to undergo for the disease, and then what consideration they'll have to take into factor, like for example, which hospital they should choose, and then the clinical workflow of appointment, registration, to the diagnostics tests, and finally the other administrative thing like billing, insurance, feedback, review mechanism, and then the continuum of care. Today, healthcare is not about the services which are rendered in the hospital. It's about the continuum of care. So healthcare extended version is the home care. Wellness is something which will make sure that there is a continuum of care. So lot of technologies has been adopted its entire pathway, right from the awareness to follow up. Next slide. This is something which I want to showcase is today we have got technology in the healthcare, but you can see how fragmented it is. There is no one holistic single solution which can able to address the healthcare need or the healthcare ecosystem need, due to various reasons. Uh, these are all few of the applications which are be primarily used by the healthcare facility on the various touch point of the patient. Suppose the patient will have to understand which hospital or the facility they should choose. Then again you got country specific, Google search and so on. People here look into a solution like Practo and so on, and then the consideration both from an hospital as well as from the patient perspective, then the entire clinical workflow of appointment, registration, consultation, and so on. People use various platforms, right? So these are all the platforms I've just taken, just displayed as an example. Many more platforms still being used by the hospital as well as the patient, and hospital, particularly the IPTs. In globally e-clinic works in center India, it's all regional specific. People use a lot of hospital management information systems. Next slide. Okay, what is the issue now in the entire healthcare ecosystem in terms of the digitalization? We talked about the touch points of the patient and the healthcare provider. So primarily, it's about the fragmented information. Till today in India, the visibility of the insurance by the healthcare providers, by the hospital, still long way to go. Still, you do not have the facility where the hospital can able to have the visibility about the insurance, which is still the patient is eligible for the time when they are getting admitted. So this is an example. Again, the information is highly fragmented across the healthcare facility, and there is lack of integration application. This is something which we will have to really look into. We have got solutions in terms of the integrated application, like for example, Philips have ICA and then GES centricity, but it all speaks with the specific devices pertaining to those organizations, right? So what we now need way forward is a platform which can able to integrate with multiple devices, medical devices, through an open source. Thereby, the data are getting seamlessly exchanged across the stakeholders. Could be the intensivist who treats the patient in ICU, could be an nursing staff who is associated with the ICU or with the nursing station, and so on. That is where the technology makes more meaningful in the healthcare ecosystem. So it's about the tightly integrated application which will aid the healthcare staffs and the healthcare practitioners to have a seamless visibility about data, and lack of meaningful analytical reporting. Again, this is a huge gap. An increasing administrative cost. Imagine an hospital will have to truly endorse technology, and they will have to use different technologies for different workflows or for the departments. There's going to be definitely an increased administrative cost, and that's one of the reason why many of the healthcare providers are not investing in technology. And more importantly, the compliance and security concerns. As far as India is concerned, the frameworks are getting built like what we have in US, HIPAA compliance, Health Insurance Portability and Accountability Act. Similarly, GDPR in Europe. So things are getting more firmed up now. Ayushman Bharat digital mission is the way forward. So compliance and security plays a major thing today. Many of the platforms technologies are not adherent to certain standards. Again, that's one of the major concerns. Next slide. Okay, so what we are doing in ZOHO for Healthcare is to build a very broad ecosystem. So as I said, we have got 55 plus applications which are available with ZOHO, how do we really correlate to the healthcare and design those solutions custom made for the healthcare practitioners? Like, for example, we have built an patient monitoring system, and we do have the well robust home healthcare system, which we have already implemented in few of the leading hospitals. Healthcare CRM, more from an administrative perspective. How do we really automate the complete sales, marketing, and referral doctor automation within the hospital? Thereby, you have a meaningful dashboard across CEOs, COOs to have some of those strategic decisions which have been put in place. And as I said, employee wellness is the critical. Today, no more the hospital visit will definitely ensure the continuum of care. It's about the post-hospital visit, how one can able to ensure that the continuum of care through the remote monitoring, through the telehealth, and so on. So we are building the complete health grid to make sure we address each of these touch points over the period of time. In next 10 years, if we can able to build the complete ecosystem through ZOHO for Healthcare is our vision. Next slide. Okay, this is something what we want to, what our vision is, what our roadmap is. There are few solutions which is already in place, and we have implemented in major institutions, in home care centers, and we are evolving to make sure that all those critical touch points of patient journey is being equipped with the technology through ZOHO. So we have got healthcare CRM, practice management software, and then the IPD we are building. We've got the complete inventory billing, and then the home care applications which are currently available, and we are now customizing to the hospital needs. Next slide. Next slide, please. Okay, so these are not built over the period of 1 or 2 years. As I said, ZOHO is in 28 plus years in the product development. We have our services of IIM, search, compliance, mail. It's all our. We do not depend on the third-party servers. We have our own cloud, and we are working on ALMN layer. And then the complete platforms. It could be a collaboration platform, IoT platform, customer experience platform, CRM, and then the employee. Everything is getting built, including the financial suite, or getting orchestrated through our ZOHO services. Thereby, we want to build the complete health grid, offering the solutions which would cater the need of the healthcare provider. So over the period of next 5 to 10 years, you will see a lot of work which has been done in the ZOHO for healthcare to have one sign-on. Thereby, hospital can able to really access all those technology irrespective of departments. Both at the administrative as well as the clinical workflow, including some of the ICU automation. To just give a gist of it, we have automated Tirupathur Government General Hospital. It's Asia's largest neonatal hospital with 45 ICU beds. And one of their bottleneck was all the 45 beds, neonatal beds, are 90% occupancy rate, and only 2 intensive care specialists being assigned to the ICUs, and they were finding it very difficult to monitor the sick babies. Right, so they want the devices which are used in the ICUs to be integrated with our platform, and we successfully done the integration of Massimo pulse oximeter, and then we Aciflow syringe infusion pump, and now we are with the ventilators. The work is on with the ventilators. So now a doctor, irrespective being in hospital, not being in hospital, through a mobile application can able to have the real-time data flow depending on the severity of the neonatals, and they can able to do the right intervention through the nurses or being with the facility. This is something what we have built over the period of time. Thank you so much.
Thank you, Mr. Balakrishnan, for sharing your experience and wisdom to the audience. As you rightly said, healthcare is not just a service in a hospital, but a continuum where the complete doctor-patient journey needs to be revitalized. I thank you again for your presentation.
Thank you so much.
Yeah, thank you. So now I invite Dr. Satyajit for his comment on the session. Yeah, Satyajit, please.
Yeah. Thank you, sir. So till now we have discussed about the smart therapeutics, digital prescription, inventory management, and the smart diagnostic point of care. So I'll be just touching about 2-3 points about how we can do smart clinical trials using this digital technology. Yeah. So next slide. So use of digital technology, advanced analytics, and innovative study design, they can make clinical trials more efficient, patient-centric, and data-driven. And Mr. Borun also has mentioned about how AI and ML can reduce the time as well as the cost of the trial in the drug development process. So if you look at this smart clinical trial ways, it can definitely address the traditional challenges like high cost, slow recruitment process, as well as the data quality issues and limited diversity. Next slide, please. Yeah, so digital technologies like e-consent process, electronic informed consent process for better understanding and compliance, and then e-pro, e-COA, that is patient-reported outcomes, wearable sensors, which can collect the real-time physiological data remotely, as well as telemedicines also help in reducing the patient burden as well as increasing the retention of the patient in a clinical trial. So use of digital technology will definitely help, as well as planning for decentralized clinical trial like hybrid or a full mode decentralized trial involving mobile nurses, home health visits, local lab facility will facilitate the trial participation. Yeah, next one. So AI and machine learning, like it will improve site selection. It will definitely reduce the burden of the industry for selecting the sites which will be taking part in the clinical trial, optimizing the recruitment process as well as risk-based monitoring. And NLP also can extract insights from the unstructured data like electronic medical records. Real-world evidence as well as real-world data like claims data or patient registry that will support in the design of the trial as well as feasibility and conducting regulatory decisions. Next slide, please. Yeah. So the benefits of smart clinical trials like using of digital technologies will definitely improve patient recruitment and retention. It can increase the data quality and real-time monitoring of the patient. It will be definitely cost effective, 30% cost effective as mentioned by Mr. Borun, and greater patient engagement and access and enhanced regulatory compliance. So we should look forward how to incorporate this digital tool into the clinical trial and make it a smart clinical trial process. It's already in the process. We can improve more and look into this in future. Thank you.
I am happy to see that we still have about 193 participants.
So, yeah, now I request Professor Pooja Gupta for her comments on this session.
So like I said, I'm happy to see that we still have 193 participants left, even when the session has been going on beyond time. And I would start by saying thank you to YK sir, not just for organizing the webinar, but also for bringing in the AIIMS cybersecurity nightmare that happened about 3 years back and is still not leaving us. So I was planning to talk a little about patient care, pharmacology, and IT. But now with that cybersecurity incident backup, the background, I think so far in terms of cybersecurity and the life cycle management of these initiatives. So traditionally, technology was static and it was meant to support medical devices. But now that the landscape is changing, technology is becoming smarter with the use of AI, as we have been seeing all through the webinar. Now, AI-based softwares use algorithms that are meant to learn and evolve. So the technology now is adaptive and not just static. And it needs to consider, so all of us, we need to consider managing the biases that this learning will bring in, The risk categorization of this technology would also need to be accounted for. And accordingly, like Balki also mentioned, the regulatory framework which was missing in India needs to, align itself with the evolving scenario. Smart healthcare in any form must be regulated through a life cycle approach, emphasizing on continuous validation, unlike the static technology or the simple medical devices. It needs to bring in transparency and robust quality controls in tandem with the regulators as the Indian health tech industry is growing very rapidly. The scientific robustness needs to ensure that there is minimum black boxing. For all the students and residents here, I think you would resonate with me when I say that most of us do not know what a statistical software is doing. That was just the beginning. We would give a command, it will give you a result. If you throw in garbage, it will give you garbage. So similar kind of black boxing is bound to happen with as the technology evolves. So if a transparent box cannot be made, the technology, it should be ensuring that at least this box is translucent. As we have seen, the Indian health technology creation is booming, particularly in the niche center of excellences, AIIMS and IITs. Those are the words we have heard, apart from, of course, the industry partners. But the technology deployment needs simplification. Like Ravi also mentioned, we need to cater to the mass medical usage in the country. In addition to scientific robustness, we need to work on the human angle also, because at the end of the day, the patient needs satisfaction of meeting the doctor. So now the patient does not understand data privacy so far. Indian population, we are still at one end where the patients treat our doctors like gods. On the other hand, we need to worry about, on the other extreme, we also have patients who are concerned about their data privacy and security. As the IT head of a major healthcare institute in the country, I keep getting requests left, right, center where people want us to delete their data from the system now that they are no longer a part of the institute and so on. But the system is not capable enough to do that for now. Anyway, so then when a patient leaves a hospital, pharmacy is usually the last point of contact, wherein in competition for with bill settlement. But pharmacy is usually the last point of contact, and a compromised workflow in the pharmacy can undermine everything with poor communication. So we need to focus also on these aspects of the healthcare grid. Apart from training and sensitization for healthcare workers, we have not yet we have not yet made ourselves capable enough to prescribe using digital platforms. We are talking about AI analytics. So that training needs to be given, especially with respect to the technology that is being used. Then everybody needs to understand a little bit, or at least the concept of the technology that is going into the systems that they are using. Regulatory and logistical hurdles that are facing the Indian startups also needs to be addressed if we want smart medical devices to reach the last mile. Just to add a little bit about what AIIMS IT team has been doing, apart from the usual HMIS, EMR, etc., we are also we have made certain applications for ease of operations primarily, but the intent is to link these applications with open source large databases and eventually multilinguistic databases also with the help of AI to increase their reach and their utilize their potential. So what we've done for now is we have set up a dashboard for emergency bed availability. We are trying to link it with the ambulance services and also with the other hospitals of the Delhi. Imagine an emergency, a critical patient in an ambulance going from hospital to hospital where the beds are not available. So this happens very frequently, and now that I'm into the system, it scares the hell out of me that if, God forbid, if somebody in my family needs such a service, what will I do? So the dashboard shows the ambulances that this is the place where bed is available and the patient can be taken there. Then we have also set up a triage registry for emergency department, which helps. Again, it is operational efficiency that we are looking at for now, but it'll be eventually linked with the bed availability dashboards and consultations. We've also set up an emergency consultation dashboard, which based on the patient diagnosis, the referrals are given to across departments from the emergency, and the doctors are aligned and reminded based on that. Linking it further with AI would prepare a most it'll help the consultations in the form that most likely diagnosis can be prepared before the patient reaches the emergency, and it alerts the relevant healthcare staff to align the resources appropriately. Then we've also set up a patient discharge summary system wherein real-time discharge summaries are generated using this platform. It improves the turnaround time and patient satisfaction. This is a very basic application right now, but we plan to link it with potential sources of drug interactions, non-adherence for patients, cost to the patient, and follow-up assessment, and so on. We also have a patient inter-AIIMS patient referral system. So now that we have AIIMS in multiple or practically all the states of the country, we are setting up so AIIMS Delhi has taken that initiative to set up a inter-referral system. Currently, it is working with between AIIMS Delhi and AIIMS Bilaspur. The plan is to set it up across all the AIIMS, wherein the strengths or the available expertise at different centers will be connected, and the patients would be referred according to their needs and their areas of residence. Then we also have AIIMS as a setup wherein the poor patients and their attendants can look for accommodation. So AIIMS, along with some partners, are providing this facility, which is called Vishram Sadan. So recently, this facility has also been made available online, where then the doctors or designated referring persons can, refer the patients or their attendants for this accommodation. The list is it automatically generates the queue on a first come first serve basis, and allows everybody to see in a transparent manner. So all this is supporting the good governance also, and making it easy for the patients. Thank you so much. Was I audible, or was I just speaking to myself?
Audible, very much.
Thank you. Thank you, sir.
Rohini, would you like to thank you very much, Dr. Pooja? Excellent, super comments by both the chairperson. Rohini, over to you.
Yes, sir. Now we will conduct a quick poll to gather participants' inputs regarding our future events. The polls will be live for a minute. Please provide your response and submit the poll.
Can you increase the size?
This poll size.
A few seconds to go. I request everyone to submit the poll. Thank you, everyone. Now I would like to call upon Shri A.K. Pradhan sir to deliver closing remark and vote of thanks.
Yeah, thank you. So as we conclude this brainstorming, session on smart medicine today, covering most of the topics which are emerging, issues. So we are very sure that the future of healthcare is actually going to be shaped by cutting edge technology of AI and real world evidence based, decision making, digitization, and personalized medicines as well as targeted therapy. So our discussions have highlighted, the vast potential of these innovations to transform the drug development, prescription analysis, and patient cares. And if we, want to take what are the takeaway message today? The first and foremost thing is obviously that artificial intelligence and machine learning powered drug discovery and development. This can accelerate the process of drug development and healthcare delivery system, reducing costs and improving efficacy. And also it can facilitate the personalized medicines, including diagnostics and targeted therapy. Further, this artificial intelligence can also actually bring optimization in terms of price negotiation, and also it can actually save the private market on pharmaceuticals, drugs and pharmaceuticals. And the second message, obviously, that digitalization enables seamless transmission of data, and that can actually bring lot of solution. It can revolutionize the prescription analysis and bring lot of solutions like, medication adherence, medicines errors reduction, and also improving the patient outcome. And as we have already discussed, the smart medicines, including drug, vaccines, therapeutics, and theranostic, can revolutionize the patient care, enabling real-time monitoring and treatment plans. So as we move forward, I think, as I have already mentioned earlier, that so far as India is concerned, we are much ahead in terms of use of digital technology for digitalizations in every spheres in healthcare ecosystem. But so far as AI and real world evidence, still India is actually is engaged heavily for discussing the issues and how to adopt this intelligence, artificial intelligence and real world evidence to shape the healthcare ecosystem in our country. So for this, I think we need to collaborate and leverage this technology to create more efficient and a robust healthcare ecosystem. So with this, I think I would like to thank, first of all, I would like to thank Professor Y.K. Gupta and Professor Digambar Bahera, the President of National Academy of Medical Science, and Professor Ashraf Alam from Vice Chancellor's Jamia University, and Professor Shakti Gupta, all are stalwarts, and they are busy in their schedule. In spite of their busy schedules, they could actually deliver their address and insights on these various topics. And I would like to thank all the panelists in the panel discussion 1, and under chairmanship of Professor Vikas Mehdi. And I was also one of the chairperson in the session. I thank Barun. I thank Professor Puneet Dhamija. I thank Dr. Sonia from AIIMS Jammu. And also I would like to thank all the panelists and chairperson, Dr. Satyajit Mahapatra, Professor Pooja Gupta, and then Professor Ravi Krishnan from IIT Delhi, Professor KP Joshi from SBS Medical College, Hyderabad, and also Mr. GN Balakrishnan from ZOHO Corporation Pvt Ltd. I would also like to thank Dr. Umesh Kopil from National Academy of Medical Science. And also I would like to, thanks the organizing team, because at the back, a lot of work has to be done for organizing such events to such, such a big events. And I would like to thank Tarun, Rahini, Sanjana, Akshit, and also Vikram Rai, who were actually there under the guidance of Tarun for making these events a successful events today. So with this, I would like to thank all the participants who have joined today, today being Saturday. I think many of us have holiday and may have other, family commitment. But in spite of that, a large number of participants have listened carefully and with full attention, as we could understand from the various comments that are actually there that have been given by the participants today. So I would like to thank all and hope this type of events we'll be organizing in the future also. So thanks for all the successful events for today. So at the end, so we'll have a national anthem. Now we can start national anthem, please.
जन गण मन अधिनायक जय हे भारत भाग्य विधाता पंजाब सिंध गुजरात मराठा द्राविड उत्कल गंगा विंध्य हिमाचल यमुना गंगा उच्चल जलधि तरंगा तव शुभ नामे जागे तव शुभ आशीष मांगे गाहे तव जय गाथा जन गण मंगलदायक जय हे भारत भाग्य विधाता जय हे जय हे